I'm in the chat. I'm being shot at! I'm going down! I'm going down! No! Ah.
Evacuate.
That is, now I'm really far away. Ugh! I've got Wii in mine. I'm gonna throw one with Wii and stones.
Is it because you hit yourself when I threw one at you?
Yeah. I like Wiiing myself. It's better than going to the toilet. I don't have to move.
It's chilly, right?
What is it?
You have to wait for them. No, she's coming, she's coming, she's coming, she's coming, she's coming.
Nothing more ready.
She's coming.
I'm coming. There she is. Get her, bro! Yeah, bro. We're not that heavy. Come on.
Yes, you are. You did it,
She
you
didn't
did
make
it. That's fine.
She didn't make it, Blaza.
So funny.
Oh, should have got all these on the soundboard. And I do that. I'm from Texas, y'all.
Look, you are scaring them.
Am I?
Took care of that.
You're not allowed to leave. Oh, the naked women running after me. Oh, ew. Help me.
We'll backtrack.
Help me.
The ladies attacked you.
The naked women attacked me.
What?
They are trying to
touch
convert
me.
you back to straightness.
Are you?
Straightism.
Oh, you're playing at the strip club.
You're playing at
Gordon,
the...
close
playing.
your eyes. Don't look.
At the basement. I'm in the basement, wow wow. Sorry. Oh god, he looks scary. He looks like a Scooby-Doo monster. Cinnamon bun time! You can put cinnamon on my bun. No way! What? No! What? This is naughty! This is naughty! Had no cinnamon buns. Gave you cookies to apologize. That's sweet. That's sweet that they gave me cookies to apologize. No cinnamon bun! Freedom!
All together now.
Freedom!
Freedom! Gotta screech it.
Linda, what did you have for dinner?
As as possible.
Oh. No.
Quick, someone clip that.
No, no.
Got you, boo.
Thank you, thank you. I'm in the chat. I'm being
I'm in a tank.
I'm being shot at! Ugh! I'm going down! I'm going down! No! Ah,
Evacuate.
that is now I'm really far away. Ugh! I've got Wii in mine. I'm gonna throw one with Wii and stones.
Is it because you hit yourself when I threw one at you?
Yeah. I like Wiiing myself. Better than going to the toilet. I don't have to move.
Each to their own.
What is
There
it?
we go then. You have to wait for them. No, she's coming, she's coming, she's coming, she's coming, she's coming.
Be more ready.
She's coming.
I'm coming. There she is. Get her, bro! Yeah, bro.
Are you ready?
Ready? Come on. We're not that heavy. Come on.
Yes, you are.
Oh!
You did it,
She
you
didn't
did
make
it. That's fine.
God.
She didn't make it, Blaza.
So funny.
Should have got all these on the soundboard. And I do that. I'm from Texas, y'all.
Rock, you are scaring them.
Am I?
Took care of that.
You're not allowed to leave. Oh, there's naked women running after me. Ew, help me.
Cool backpack.
Help me.
The ladies attacked you.
The naked woman attacked me.
What?
They are trying to
don't
convert
say.
you back to straightness.
Are you?
Straightism.
Oh, you're playing at the strip club.
You're playing at
Gordon,
the...
close
playing.
your eyes. Don't look.
At the basement. I'm in the basement, wow. Sorry. Oh god, he looks scary. He looks like a Scooby-Doo monster. Cinnamon bun time! You can put cinnamon on my bun. No way! What? No! What? This is naughty! This is naughty! Had no cinnamon buns. Gave you cookies to apologize. That's sweet. That's sweet that they gave me cookies to apologize. No cinnamon bun! Freedom!
All together now.
Freedom!
You gotta screech it.
Linda, what did you
Quick,
have
be
for
as
dinner?
selfish as possible.
Oh. No.
Quick, someone clip that.
No, no.
Got you, boo.
Thank you, thank you. I'm in the chat. I'm being
I'm in a tank.
I'm being shot at! I'm going down! I'm going down! No! Ah,
Evacuate.
that is now I'm really far away. Ugh! I've got Wii in mine. I'm gonna throw Wii. I'm gonna throw one with Wii and stones.
Is it because you hit yourself when I threw one at you?
Yeah. I like weeing myself. It's better than going to the toilet. I don't have to move.
Each to their own.
What is
Yeah,
it?
you have to wait for them. No, she's coming, she's coming, she's coming, she's coming, she's coming.
Be more ready.
She's coming.
I'm coming. There she is. Get her, bro! Yeah, bro.
Are you ready?
Ready? Come on, we're not that heavy. Come on.
Yes, you are. You did it,
She
you
didn't
did
make
it. That's fine.
She didn't make it, Blaza.
So funny.
Should have got all these on the soundboard. And I do that. I'm from Texas, y'all.
Rock, you are scaring them.
Am I?
Took care of that.
You're not allowed to leave. Oh, the naked women running after me. Ew, help me.
We'll back that.
Help me.
The ladies attacked you.
The naked woman attacked me.
What?
They are trying to
don't
convert
say.
you back to straightness.
Are you?
Straightism.
Oh, you're playing at the strip club.
You're playing
Lord,
at the...
close
playing.
your eyes. Don't look.
At the basement. I'm in the basement, wow. Sorry. Oh god, he looks scary. He looks like a Scooby-Doo monster. Cinnamon bun time! You can put cinnamon on my bun. No way! What? No! What? This is naughty! This is naughty! Had no cinnamon buns. Gave you cookies to apologize. That's sweet. That's sweet that they gave me cookies to apologize. No cinnamon bun! Freedom!
All together now.
Freedom!
Freedom! Freedom! You gotta screech it.
Linda,
Quick,
what did you
Lord,
have
be
for
as
dinner?
selfish as possible.
Oh. My.
Quick, someone clip that.
No, no.
Got you, boo.
Thank you, thank you. Hi everybody, hi diamonds! Happy Tuesday to you all. I hope you're feeling incredible, feeling wonderful, having an amazing day so far. And I hope you guys are missing me like I'm missing you. Hi Julia, and hi Dibson Dipson. I hope you guys are feeling good. I'm not used to not streaming every single day of the week. Hi Cami. Cami, that's that. How are you, Cami? Oh, I missed you too. And hi Erin, hi guys. Sorry I took so long to start my stream. I started my countdown and then got a bit sidetracked and busy. Hi! Oh my god, I forgot what your name was, boy with a little finger. That's okay, Erin. You made up for it by going back here. Cami, what are you up to? How was your trip? Are you back home now, Cami? But guys, I'm not used to not being able to stream daily. Usually I would stream well, not usually anymore, but I used to be able to stream like 4 or 5 days a week. Roman, that's it. Hi. Why is your name Boy with a Little Finger? I used to be able to stream like 4 or 5 days a week, but now I'm lucky if I get to stream 2 days a week, because on the weekends I'm busy, and then on the weekdays I'm busy depending on my schedule in university. Like next week I'm in 4 days. This week I'm in 3 days. Next week I'm in 4 days. And then the week after I think I'm in 5 days. So there'll be no stream on that week. 1 stream next week. 2 this week. Today on Friday. I think I can stream on Friday. But yeah, it's taking a lot of my time up. But I'm really enjoying myself. I'm really enjoying being a student again. And I'm really enjoying learning. Like yesterday was a really, really interesting lesson. We learned about some blood disorders. Actually, no, I can't say we learned about blood disorders, plural. The lesson was about sickle cell disease and thalassemia. However, it was actually just focused on sickle cell disease. It wasn't actually... There wasn't anything about thalassemia, to be honest. It was just sickle cell disease. But it was very interesting because, you know, we learnt... we just was educated more on what sickle cell disease is, what it can cause, how we can help, and what a sickle cell crisis is, and then what can be done. And honestly, it's really quite upsetting because when there's no cure for sickle cell disorder, sickle cell disease, but there's also not much management, really, not really great management. So for example, when a patient has sickle cell crisis, what that refers to is severe pain. Oh, I enjoy it, Roman. But Roman, why is your name Boy with a Little Finger? So a normal... No. Junmi, hello, it's good to see you. Hi, Junmi. I've been waiting to see you on my stream. Love you, Junmi. Love you. And hi, Julia Jindobre, how are you? A normal shaped hemoglobin not yet, Erin. So my calculation test is next month in November, and my assessment is handed in next month as well, just before the numeracy exam. Hi, Marky. How are you? So the normal shape of a red blood cell hemoglobin is concave or concave. So basically, it's like a circle with like inwards. So that means there's more surface area for oxygen to, you know, attach to and get transported around the body. But patients with sickle cell disease, their shape is a sickle, and it becomes more rigid, and that means it can get stuck. It means it transports less oxygen around the body because there's less surface area for the oxygen to attach to, and also it becomes more rigid, which means it can block. So it can cause a blockage here. It can cause a blockage anywhere on your body. And then so when a sickle cell gets blocked, it causes a sickle cell crisis, which is so painful because, you know, blood isn't able to flow due to the blockage. And the only thing really that can be done to help that is medications. There was a chemotherapy drug that encourages the production of hemoglobin hemoglobin F. I'm good, thank you, Marketta. How is your day? Sometimes sickle cells can accumulate in the spleen, and a blockage is caused, which means that the spleen has too many red blood cells, which causes like a spleen sequestration, I think was the word. Can damage arteries, vessels. That's okay, Raymond. Hope you're having a good day. But basically, yeah, it was just a really interesting lesson about about sickle cell disease. Yeah. Oh my God! Hi, Zazu. Zazu, how are you? How are you, Zazu? I'm a nursing student. Is it the hemoglobin? Is the hemoglobin hemoglobin shape or red blood cell shape changed in sickle cell disease? The abnormal hemoglobin causes the red blood cell shape to change. Ah. So yeah, it's the red blood cell shape that changes. Hi Zazu, how are you? Oh my god, Marky, did you sleep well? Biconcave's usual shape. Yes, exactly. So what that means is there's more surface area for oxygen to travel around the body. And it's less rigid. I don't know the opposite word for rigid, but it's less rigid, which means it can fit through small spaces. But sickle cell anemia, sickle cell disease, the shape is a sickle, which means less hemoglobin is attached to it, meaning less oxygen. And it becomes a bit more sticky, more rigid, which means it can block, which causes sickle cell crisis because the blood flow is restricted, causing loads of pain. It can cause issues like damaged vessels. It can cause spleen sequestration, I think was the word it was that was caused. I think it was called spleen sequestration, where build-up of red blood cells in the spleen become trapped, damaging the spleen. Dawson, you know more about that. Slept at labour, 4 AM. Yes! Who's labour? Who's labour, Mark Edda? Wow, was you doing a night shift, mister? Yeah, Zazu, you've got to overcome these issues so you can see what I'm going on. So you can see how I'm getting on at university. It was a really interesting day yesterday. We was talking about distress in nursing, so mental health problems and, you know, just being aware that people can react differently with emotional distress and, you know, what can we do? Popsicle anemia. What's popsicle anemia? Oh, thank you. Thank you, Johnny. I need to have a wee already, and my lip is still sore, as you guys can see, which is really annoying. I went to the pharmacist and I said, can you offer me some medication advice, you know, creams for my lip? And they said, no, you've got to get a prescription from a doctor. The issue with that is it takes about a month or 2 months to get a doctor's appointment. So if I book it now, this is going to be gone. This is recurring. It always happens. I get it like at least 2 times a month. However, it gets better. Get better. Knowing my luck, it'll probably be gone by the time I go to the doctor, and then I'm completely fine. My lips are fine. Oh, thank you, Zazu. Bless you. Yeah, well, this is my 3rd week now, Zazu. Are you working today, Mr. Marquetta? This is my 3rd week. And yesterday was very interesting. Erin, I don't think there's any chance of that, unfortunately. But yeah. Mental health and emotional distress in the morning, followed by sickle cell disease in the afternoon, which was very interesting. Call the out of hours? Marky, my GP closes at 5. Can't call my GP anytime past 5. Thank you, Junmi. Actually, this one is angular cheilitis. I'm a 3-week student nurse year 2. Yes. Where are you going, Marketta? You're not staying on my stream? But yeah, it was a very interesting day yesterday. Learning about sickle cell disease and sickle cell crisis. Hi, Jack. How are you? Hope you're having a good day so far. There will be no chance of getting in at the same day. Yeah, but Marquetta, there is no local clinic, and I don't drive. There's only one GP surgery in my town. But yeah, it was a really, really interesting day yesterday. But to be honest, guys, I'm enjoying getting all this information. It's quite intimidating having to retain it. But to be honest, the nurse that talked about sickle cell disease, she works in hematology, so she's a hematologist. She's a hematology nurse. So she said as well, I had no idea what sickle cell disease was until I began working in hematology. And so every day is going to be a learning day, even when I've graduated. And to be honest, nursing and health is so broad I need to focus on an understanding of the area I go into. So, for example, if I go into diabetic nursing, my expertise needs to be diabetes rather than burns, for example, because I'll be working with diabetic patients rather than burn patients. So it'd be good to have an understanding of burns, but I need to focus on the area I want to be in. If I want to work in if I want to work with heart conditions, there's no point really having an expertise in respiratory issues because I need to focus on the heart. But yeah, it'll be a learning day all the time. Oh, I'm glad, Jack. What are you up to today, mister? Yeah, I don't think that'll happen, Mr. Mucky. But I can try calling out of hours and see. But I'm in university tomorrow, so I can't get a same day tomorrow. Hi, Kaylin. Good morning. How are you? Is your laptop broken? Is your lappy broken? Korean sticky chicken. Oh my god, can you take a photo and show us when it's done? But yeah, I'm really interested learning all that I can. It is a little bit intimidating, how much knowledge I'm trying to take in, but I just need to remind myself every day will be a learning day, and once I find an area I want to go into, then I can expand on that knowledge. Yes, hematology nurse. I'm good, thank you, Kaylin. It's good to see you. How are you today, mister? And what are your plans for today, Kaylin? Hematology. So it's like blood, right, Zazu? Blood conditions. A nurse relating to blood conditions. This is what I wore yesterday, by the way. This is the outfit I wore yesterday to the university. Cool. And guys, I am just going to go quickly put something in the bin. I did, Sazu, yes. I got nursing shoes. And I have my nursing uniform, Zazu. I'll tell you about that in a second. I did, Marky, yes. Thank you so much. Actually, that specific lingerie is in my bedroom waiting for me to try it on. I'm not sure when. I'll try and prioritize that one. But obviously, I've not really been trying on my stuff, and yeah, because I've not really had time. I either go to university or stream or yeah. So when I find time, I'll prioritize that one for you. But yes, I got my uniform, Zazu, and I got my nursing shoes. So Zazu, in England, scrubs are being introduced. So I don't know if you know, but in England healthcare, scrubs are mainly for surgeons. You'll mainly see surgeons in scrubs, right? Or maybe some pediatric nurses, but mainly surgeons. Nurses, we wear dresses or tunics and trousers. We don't really wear scrubs. So for students, this year, students that have started this year are going to be introduced to scrubs. So their uniform is going to consist of plain trousers and a scrub top. However, because I'm going into year 2, not year 1, I'm going to have the same uniform as all of year 2, so I'm not standing out and people can tell that I'm year 2. So I miss out on the scrubs and I'm getting the original uniform. It looks better, but it's not as comfortable. So I suppose it's a win-lose. Thank you, Maketa, but no. If I'm modelling, you like it. Maybe we can try on some more. No, I won't wear a dress, Sazi. I mean, maybe the hospital will be, but getting there probably won't be either because I have to get the train. But yeah, I am really enjoying my time. I'm spending a lot of time focusing on my studies. So I'm attending every class. It was very fascinating learning about sickle cell disease, even though I'm not thinking or considering, at least yet, about hematology. my interest is still wounds and burns and injuries. So it's good to have this knowledge, but I'm stressing about retaining it and remembering it all. But then again, I don't really need to, because every single day will be a learning day. Plus, I should expand on the area that I want to work in, as well as, you know, research outside of it occasionally. But as long as I can focus on an area that I want to go into when I graduate. Oh my god, Jack, you're working on your car today, checking them for the acronym. Petrol, oil, water, electric, and water. Rubber. Ooh, how long is that going to take you, Jack? I'm good, Zazu. I am a little bit stressed, hence my poorly lip, but I'm really enjoying it. I'm really enjoying it. I've got an assessment already, Zazu. So my days usually go like this. I go to university, I get home, have dinner, watch my episode of a series I'm watching whilst I'm eating, then come up, work on my assessment or do some studying, go to bed. So I'm doing my first assessment so far, and I'm making some good progress. I was working on it again last night and this morning for my stream. I'm making some good progress. I've got one more part of this lesson to do. So my assessment has 6 goals I need to meet. I need to meet 6 requirements. I've done the first 3, not passed because I've not submitted it yet, but I've wrote the first 3. Now I'm on the 4th one, and it's going to be like 2 components. I've already done the first component now, so I've got to do part 2 of it, and then that's done, which leaves me with 2 more questions, outcomes to meet, and then a conclusion. And then I have to do it in an audio and hope that it comes under 25 minutes. Because I have 25 minutes, no less, no more than 25 minutes. And I really hope that what I'm writing doesn't go over 25 minutes. I should probably start, you know, reading it now and timing myself and seeing how much time I've got left for the next. But it's really difficult, Zazu, because they want us to be critical, which means talk about this and this and this and this, talk about it at different angles. You know, for example, let's take a very generic one. What, speak faster, yeah. But Susan, then they'll ungrade me for not being, clear. But here's a very broad one, okay? So, I'm doing HIV as a topic, right? And one of the questions is, what impact does HIV have on well-being? And that can be anything. You can talk about the well-being on the patient, the well-being on their sexual partner, romantic partner, boyfriend, girlfriend, whatever. You can talk about themselves, their boyfriend or girlfriend. You can talk about their family. You know, maybe their family are worried. Maybe their family hates seeing them be discriminated against. Maybe their boyfriend or girlfriend is uneducated and unsure how to protect themselves. Maybe hesitant. All having more effects on the individual because they're stressed about worrying their family now. You can talk about the negatives, such as, you know, they're anxious, they feel judged, they feel ashamed. But then you can also talk on a different aspect as well, the positives, because there are positives. For example, they might be more health conscious. You know, they might be like, okay, I have an illness. Now I need to make sure that I'm looking after myself. So they're more health conscious. They'll visit the doctors more often, which means that they can get more checkups. Also, maybe they'll be encouraged to meet fellow patients of HIV, meaning they make more friends. There's just so much you can talk about, but I don't have the time, which is the stress. Thank you, Junmi. I love you. Yes, I'm enjoying myself. It's just hard. It's hard doing this assessment with critical thinking whilst trying to keep it under 25 minutes. Because there's so much I could say. I could spend 25 minutes on the well-being alone, but I still have 5 other objectives as well as an introduction, explaining what HIV is, explaining what primary care is, and then a conclusion. Not enough time. But I'm enjoying it. I've got some practicals coming up, I've got an infection prevention and control practical. I've got basic life support and choking practical. I have to pass that 100%. Well, not 100%. They're not going to like judge it in numbers, but I've got to just demonstrate that I can perform it. So I'm doing adult nursing. However, I won't be surprised if they want us to demonstrate this on an adult, child, and infant all together at the same time. Not at the same time, but in the session. So for an adult, what I'm going to do is I see them laying on the floor. I'm going to firstly call for help. You, person wearing the blue hoodie, call for help, please. Tell them, although... Oh my god, congratulations, Azzy! Guys, tell me, actually, that's something I need to consider. So for example, somebody's laying on the floor, my first action is, do I tell someone to call for help, or do I go and assess them first? Because, you know, what if they're okay? Guys, this is a phone call I need to answer. This might take me 10 minutes. Please bear with me, okay? This might take me 10 minutes. I'm in the chat. I'm being shot at! I'm going down! I'm going down! No! Ah.
Evacuate.
That is, now I'm really far away. Ugh! I've got Wii in mine. I'm gonna throw one with Wii and stones.
Is it because you hit yourself when I threw one at you?
Yeah. I like Wiiing myself. It's better than going to the toilet. I don't have to move.
Each to their own.
What is
Yeah,
it?
you have to wait for them. No, she's coming, she's coming, she's coming, she's coming, she's coming.
Nothing more ready.
She's coming.
I'm coming. That shit. Get it, bro! Yeah, bro.
Are you ready?
Ready? Come on, we're not that heavy. Come on.
Yes, you are. You did it,
She
you
didn't
did
make
it. That's fine.
She didn't make it, Blaza.
So funny.
Should have got all these on the soundboard. And I did it. I'm from Texas, y'all.
Alright,
Rock, you are scaring them.
Am I?
took care of that.
You're not allowed to leave. Oh, the naked women running after me. Ew! Help me!
Pull back that.
Help me!
The ladies attacked you.
The naked women attacked me.
What?
They are trying to
don't
convert
say.
you back to straightness.
Are you?
Straightism.
Oh, you're playing at the strip club.
You're playing
Rory,
at the...
close
playing.
your eye. Don't look.
At the basement. I'm in the basement, wow. Sorry. Oh god, he looks scary. He looks like a Scooby-Doo monster. Cinnamon bun time! You can put cinnamon on my bun. No way! What? No! What? This is naughty! This is naughty! Had no cinnamon buns, gave you cookies to apologise. That's sweet. That's sweet that they gave me cookies to apologise. No cinnamon bun! Freedom!
All together now.
Freedom!
Freedom! Freedom! You gotta screech it.
Linda,
Quick,
what did you
Lord,
have
be
for
as
dinner?
selfish as possible.
Oh. My.
Quick! Someone clip that!
No, no.
Got you, boo.
Thank you, thank you. I'm in the chat. I'm being
I'm in a tank.
I'm being shot at! I'm going down! I'm going down! No! Ah,
Evacuate.
that is now I'm really far away. Ugh! I've got Wii in mine. I'm gonna throw Wii. I'm gonna throw one with Wii and stones.
Is it because you wet yourself when I threw one at you?
Yeah. I like weeing myself. It's better than going to the toilet. I don't have to move.
Each to their own.
What is
Yeah,
it?
you have to wait for them. No, she's coming, she's coming, she's coming, she's coming, she's coming.
Nothing more ready.
She's coming.
I'm coming. There she is. Get her, bro! Yeah, bro.
Are you ready?
Ready? Come on. We're not that heavy. Come on.
Yes, you are. You did it,
She
you
didn't
did
make
it. That's fine.
She didn't make it, Blaza.
So funny.
Should have got all these on the soundboard. And I did it. I'm from Texas, y'all.
Alright,
Rock, you are scaring them.
Am I?
took care of that.
You're not allowed to leave. Oh, the naked women running after me. Ew, help me.
We'll back that.
Help me.
The ladies attacked you.
The naked women attacked me.
What?
They are
Don't
trying to
say.
convert you back to straightness.
Are you?
Straightism.
Oh, you're playing at the strip club.
You're playing
Lord,
at the...
close
playing.
your eye. Don't look.
At the basement. I'm in the basement, wow wow. Sorry. Oh god, he looks scary. He looks like a
Okay,
Scooby-Doo
what's
monster. Cinnamon bun time! You can put cinnamon on my bun. No way! What? No! What? This is naughty! This is naughty! Had no cinnamon buns. Gave you cookies to apologise. That's sweet. That's sweet that they gave me cookies to apologise. No cinnamon bun! Freedom!
All together now.
Freedom!
Freedom! Freedom! You gotta screech it.
Linda,
Quick,
what did you
George,
have
be
for
as
dinner?
selfish as possible.
Oh. My.
Quick, someone clip that!
No, no.
Got you, boo.
Thank you, thank you. Hi guys, so I had to go outside. I had a phone call from my energy and gas bill provider, and they just needed some photos of my meters to help me get. So basically, I have a smart meter, but the gas isn't working, so they needed a photo of my gas meter to link it up. I'm back. I'm just googling something. During an emergency, do I call for help first or assess? Because what if somebody's just laying down and I mistake, oh my god, help, call the police, call the ambulance. But actually they're like, what? No, I'm laying down, I'm fine. So do I call for help or assess? Assess for danger, then call for help. So I have to make sure. Zazu, do you have a camera in my bathroom? So before I say, call for help, someone's on the floor, I have to assess and make sure that they're actually in danger. Because somebody could be laying down in a park sunbathing and I'm like, oh my god, call for help. And it turns out, what? No, I'm fine. So I think personally what I would do is if they've fallen to the ground, if somebody's fallen to the ground, then I would probably say, you call for help. I'm going to go and see if they're okay. Assess the danger, make sure it's safe for me to go and help. However, if somebody's just on the floor, then I would just go and see, make sure they're breathing and see what the matter is. If they're not breathing, then I'll say, help. And then I'll start with, so, first aid, call for help, assess my danger, make sure there's nothing that can hurt me. No cars coming, no loose wires. It's safe for me to approach. Check to see if I can feel some breathing. See if I can see any breaths raising from the chest. Feel any breath on my ear. The patient's not breathing. You call for help. Tell them that we have an adult unconscious individual. See you, Erin. Good luck with your studying and see you Friday. Exactly, Zazie. They might not actually need an ambulance, but let's just say they really are unconscious. So, run up, assess the danger, and I'll say, you, Zazu, please call the ambulance and explain that there is an unconscious adult who's not breathing, who's fallen to the ground. We need to specify adult unconscious. And then I am going to perform CPR, sternum, 30 compressions. Hi, Alma, how are you? Sinwa. Hi. How are you, Alma? Thank you so much for the bits. Kutas. How are you, Alma? We're just talking about some CPR, because I've got a CPR practical to do. On Halloween day. It's on actual Halloween. So on the Friday of Halloween is when I've got my CPR practical. So call for help and specify it's an adult unconscious not breathing. Thank you, Zazie, for letting me know. I hope he comes back. Okay, start CPR, 30 compressions. And then... mouth over the mouth. See if there's breathing. More. Hi, Mike, how are you? Over and over again. Now... yeah, grab the nose, fingers under the chin. Or is it grab the nose? It can't be like this, because then you can't. Because if I've got my fingers on their nose, pinching their nose, and my hand on their forehead, leaning them back, I can't give mouth to mouth. So yeah, it's pinch nose, fingers under the chin. But yeah, you do 30 compressions, see if there's any breathing. Pinch nose, fingers under the chin, lift back, mouth over the mouth. One breath, put your ear to see if they're breathing and see if there's any rise. Next breath, do the same, see if there's any rise, and then again. But you have to make sure you go all the way down, up, not like this. Not like this, but down, up, down, up. Because if you do it like this, and you don't let it release fully, you're not going to be pumping efficiently. Arma, how's work going? 16 hours at work. Mike, how was it? You must be exhausted. But for children, you again want to specify it's an unconscious child not breathing. Start with 5 compression breaths, 5 rescue breaths, 30 compressions, 2 breaths, 30 compressions. Same for a baby. But for a child, you want to do 1 hand. For a baby, 2 fingers. But Zazu, so if you pinch your nose and lift it, it allows you to open the mouth, Zazu. So like imagine the mouth's closed. Doing that isn't going to open their mouth. Grab their nose and lift. It's going to like open up their mouth. Oh my, Mike, I hope you're getting paid well for this because you must be exhausted. But yeah, for babies, 2 fingers, child 1 hand, adult 2 hands. Children and babies start with 5 breaths, 30 compressions, 2 breaths because usually it's for respiratory issues. And then choking. So for an adult, hello, are you okay? Can you cough for me? If they can't speak to me, hi Zazu, are you okay? Zazu, are you okay? Can you hear me? No. Hi Zazu, are you okay? Can you talk to me, Zazu? Can you say something? Zazu can't talk. Okay, Zazu, cough, cough. Give me a big, deep cough. Cough for me, please. Okay, she's not able to cough it out. Because if you cough, it might dislodge whatever's obstructing. She can't cough. It's not coming out. Okay, please lean forward, Zazu. I'm going to help you. Lean you forward a little bit. 5. I'm going to give you some back blows. 5 back blows to the middle of the shoulder blades on the back. And checking to see if it's been dislodged each time. That's not worked. Right, I'm going to administer Heimlich maneuver. Stand behind her. Lean her forward a little bit. Hand like this. Inwards, upwards. Inwards, upwards. Constantly checking to see if it's came out. If it hasn't worked, back blows again. And then Heimlich, back blows, Heimlich. Okay, she's not breathing. She's collapsed. Recovery position. Okay, she's not breathing at all. CPR. Sorry, Zazu. Sorry. CPR. I'm excited! I think I can perform first aid, but when I do it in the practical, it's just going to reinforce that I can. And Zazu, you know, if the patient is pregnant, you don't want to do the Heimlich maneuver because it can damage or hurt the baby or the mother. So you don't want to do Heimlich maneuver. Instead, you want to do chest blows. So middle of the chest, inwards, not upwards, inwards, inwards. Or if the patient is really obese and I can't put my hands around them all the way, I'll do the chest instead of the abdomen, and inwards, inwards. And that goes for babies. You want to do chest blows. And I think even children. But we don't care about children. I'm doing child's nursing. I'm doing adult nursing. Right. Tears in rain. Obese. Obese, Zazu. Obese. I did used to call obese as a child. I'm sure many people did that, didn't they, though? Used to think obese. Yeah, obese is actually obese. So yeah, I would assess the situation, make sure actually help is needed. Because sometimes they might just be laying down sunbathing, like, call for help, but actually they're just laying down. Zazu, I am getting the platinum trophy. Obesity. Obesity. Oh, Mike. Something that I found really funny is, you don't have OCD, you have obesity. You don't have OCD, you have obesity. Because, you know, you get it. OCD, obesity, obesity. That was made by Zazu, that joke.
Unless you touch, girl.
Just kidding. But yeah, I've got plenty of time to see what nursing I want to do. Do I want to do wound care, tissue viability, injuries, intensive care? Do I want to do burns? Do I want to do a surgical ward? What kind of nursing do I want to do? I've got plenty of time to figure that out. Oh my god, Zazu, the A to E approach. The A to E assessment, making sure that their airways, breathing, circulation, disability and exposure is satisfactory. I do, Zazu. I don't like the smell, but I love wounds. Well, no, to be honest, I like injuries rather than wounds. Like, I want to suture up. If somebody has some glass sticking out of their arm, I want to suture that up. I want to learn how to suture and carefully remove that piece of glass, stop the bleeding, suture it. To be honest, if I think of wounds, I think of bed ulcers, bed sores. However, injuries is what I want to do the most.
He used to be a cop.
You've got to be careful with that though, Zazu. If I'm taking glass out of a patient, I have to be very careful not to cut myself on that same bit of glass. Because number one, their blood can be on the glass. So if I cut myself on the glass, their blood mixes with my blood. If I cut myself on the glass, my blood will mix with their blood as well. Because of course, my blood will spill. So you've got to be very careful with glass and sharp objects like that. Because their blood can pass to mine, mine to theirs. Oh my god, Mike! Glass bones and paper skin. Then I'll look after you. Mike, I can't believe you're working so much. Zazu, what kind of nursing areas do you think I should consider? I'm considering wounds, injuries, surgical, so you know, looking after patients who have just had surgery, and burns. I want to spend time with the burns team.
A cop's uniform. Always trust a cop.
It's because you're working
That's why
hard to
children
provide,
with
Mike. Are
names
you
dressed as a
singing, by the
cop.
way? They need to teach more about thalassemia, because yesterday we did a lesson on sickle cell and thalassemia, but there was nothing about thalassemia. Thalassemia is not the same as sickle cell disease, right? Oh my god, it is! No, yes, I am correct. Thalassemia and sickle cell disease are not the same, although they are both genetic disorders. Yeah, so we didn't learn about thalassemia, we just learned about sickle cell disease. Why is sickle cell disease and thalassemia linked? It's not the same. I think sickle cell disease refers to the lack of hemoglobin being passed around the body and the shape of the hemoglobin, whereas thalassemia refers to the lack of production of hemoglobin.
Shit, it needs a password.
Oh, really, Zazu? Oh dear. Yeah, anytime you have a needle stick injury, you must go to occupational health. He's not a cop, he's a stripper. Yeah.
How does this twisted fuck's mind
That's what you gotta
work?
do, Mike. Get some pep.
Gotta be something related to his
To exposure
childhood.
prophylaxis.
What did he call those paper dogs when he was a kid?
What was I gonna say? There was something more I wanted to talk about. Yes, thalassemia and sickle cell disease. Thalassemia refers to the lack of production of hemoglobin, whereas sickle cell disease refers to the shape of the red blood cells.
Over, Scott. All those children killed just to find a father capable of saving his son?
Shut up! You don't understand.
There's one child left. There might still be time to save him. Let him go. Do what your father couldn't do.
In your eye. Yeah, anything with eyes, Zazu, you go to an ophthalmologist because they're super sensitive and delicate. Mom. Mom, Zazu. Zazu, mom. Tears in Rainbow. After doing ending 3. After doing ending 3, Lucas waits to find an escape, but she doesn't look at the laptop to find the My, was it drops or ointment, Miss Zazu Rex? ZASU. Oh, Mike. That is very lucky. Can you imagine how sore it would be? An eye injury. Yeah. Zazu, have you slept yet? Do you miss me, Zazu? I'm a nursing student. I'm a nursing student, Zazu. My second year. Missing more, Zazu. Oh, Mike! You got a charmer of a man. So, Mike, why are you working so much these days, mister? And what's everybody having for dinner? I'm thinking to do some pasta. Either bolognese pasta or pesto pasta. Need money. Just please don't overwork yourself, Mike. You don't want to be working extra for all this money, only to then get ill and need some time off. She's like, oh my god, my house would look nice with this and this. No, you funny man. No, you're not. Zazu, so this current objective I'm on for my assignment is talking about health promotions. So, you know, what campaigns are there to promote health? The stop smoking, the better eating, you know, stuff like that. So we need to talk about that. And my subject is HIV. So HIV and stop smoking, it doesn't really directly link, right? There's not a direct link, same as HIV and exercise, HIV and healthy eating. It's not really a direct link. So I have to kind of myself do it, you know, myself link it together. So for example, the way I'm going to do it is smoking doesn't cause HIV. However, you know, and if a HIV patient has, if a patient has HIV and they stop smoking, it's not going to cure HIV. So there's not really that link there. However, people with HIV are unfortunately more vulnerable to diseases. There's some certain diseases they're more vulnerable to. And so, because they're already vulnerable, if they smoke as well, that also makes them even more vulnerable. So they need to kind of like take away the extra vulnerability that they can control. They can't control their HIV status. They can control their exercise, their smoking. So if they take that away, then yeah, they're at lower risk of developing these illnesses. I need to write that down. I need to write that down. That word, control. They have control. I need to write that down. But yeah, if they stop smoking, it's not going to cure the HIV. However, they already are more vulnerable to these diseases. Smoking will just add to that vulnerability. Where's the stop smoking? Quit smoking campaign.
Our main headline today. It is reported that the police have
Do not have control over HIV status, but do control exercise and smoking choice. Cool. Nice. Because I could have talked about many things. The opt-out strategy, which means that when you take a blood test, rather than opt in, you can opt out to a HIV test. And what that does is it stops people from needing to ask. People don't need to ask, can you please test me? They might be embarrassed, they might be ashamed, they might be unsure. So by doing opt-out with blood tests for HIV, it gives everybody the chance to take a test without them having to ask. Yeah, I mean, it's all about chance, Zazie, you know. Oh, it's all about reducing chance, you know. I could still get lung cancer even though I don't smoke. However, my chance of getting lung cancer is not as high as somebody who does smoke. However, there are some cases where I could get the lung cancer and the smoker doesn't. So it's all about chance. But yeah, when you have HIV, you are more vulnerable to certain cancers. So you need to reduce the risk as much as you can.
I can't pretend to know what you've been through, but I'm here for you. If you want to talk to someone about it, you know I'm here. Right, I'll try again later on.
True that, Zazie. Oh my god, yeah, secondhand smoking.
What are you gonna do now? I don't know. Resign? Try to forget? I don't know. Is Tripto part of your plan to forget? It's the most effective way I found. Except it's not a solution.
Cool. Wow.
For the moment,
yeah, so for this assessment, what we had to do is we had to pick one long-term condition. So it could have been asthma, it could have been diabetes, it could have been HIV, it could have been sickle cell disease, it could have been arthritis. So for our assessment, we need to focus on that illness. So for example, stop smoking would be a very good one for somebody with asthma. So if I had chosen asthma, that would have been a good one to follow, but I didn't choose asthma. And so asthma, also, no, diabetes, sorry, diet and exercise would have been a good one, but I have to link as much as I can to what I have, which is HIV, the condition I'm talking about, not that I have, sorry. Zazie, I have chosen on HIV because I've already done the first 3 outcomes, and I do not want to start again because I've done my research, got my evidence, and I've done the first 3 outcomes. And if I start again, I have to do all of it again. My research and finding evidence, finding references. Yeah. Definitely too late. Oh my god, really? Also, guys, there should also be a correlation. I've not really looked into it, But is smoking weed just as bad, or worse, or not as bad as nicotine cigarettes? I'm not sure. Thank you, Zazu. I will talk about the, stop smoking, because they are already at risk. The HIV puts them at risk of certain cancers and diseases. So they're already... So this is me at risk 0, for example. Not 0. This is me down here at risk. This is somebody with HIV at risk. But then if this person decides to smoke as well, they're going to be even
I want to see them again.
higher.
Your father too.
Is it really worse? I could also talk about legislation. How does legislation promote health and well-being? Well, may it stay that way, Mike. I hope you never have lung issues. But, I read that when, in the UK, if you have HIV, you do not need to tell your sexual partner. So, if Brenda had HIV and she's dating Bridget, she doesn't need to tell Bridget she has HIV. However, what is legal requirement is non-reckless transmission. So if Brenda was not to tell her, that's fine. But if she was to pass it to her, or pass it to anybody else recklessly, knowing her condition, then that's against the law. So that can, reduce, reckless transmissions. But then it should just be a law to be upfront. But then if everybody should be upfront, we need to tackle stigma first, because, people are not upfront because of stigma. There's so much to it. No, Zazu, talk about campaigns already that are already made. Talk about campaigns that are already made, Mom, Zazu.
Stay back! Don't come near me!
I agree, Zazu. I do think you should have an obligation to tell your partner. But no, Zazu, I don't need to make a campaign. I just need to talk about already made campaigns. So there's already a stop smoking campaign that I can talk about. I think I need to redo the health and well-being, because there's so much to that to talk about. There's just not enough time. Agreed. So I could talk about legislation, or I could talk about the stop smoking, or I could talk about the opt-out strategy. I don't want to do all three, I only want to do one more. Exactly, Zazu. But I don't really know if there are any. Let's see. Let's see if there are any. Campaign. UK. It's got to be UK. It has to be UK. I can't talk about American campaigns or anywhere else. UK campaigns. HIV. The annual National HIV Testing Week. It starts with me. See, National HIV Testing Week. It is an annual event in February that promotes regular HIV testing, especially in the mum's high risk group. So, for example, what that means is there's 1 week in February that people should test. However, that's good, sure, everything should have, a week to promote itself, Let's do a diabetic week, let's do an asthmatic week, just a week to promote different illnesses. However, everybody should be testing all the time, not just during that week. So that's a barrier to it. Annually is a very long gap. You know, they shouldn't just be doing it every week, every 1 week in February each year. They should do it every single time. So really, yeah, okay, that campaign is good because it gets more visibility. However, everybody should be testing, you know, frequently. Yeah. Education, transmission, symptoms prevention, testing, promotion, encouraging testing for those who are high risk. Yeah, and there's also with that, Zazu, I explained already in my no, I don't want to go into too much details. I don't know what's going to be copyrighted now. So encouraging testing for those that high risk groups treat Zazu. That's good because, you know, there are high risk groups. However, if we focus on encouraging them, well, anybody could get it. Anybody can get HIV. So rather than focusing solely on high risk groups, we should focus on everybody. Everybody can get it. Everybody should be tested. So yes, we should probably emphasize high risk groups, but we shouldn't slack on everybody else because they also can get it. Hi Alex, how are you? 10th to the 16th of February 2025 was HIV testing week. To be honest, I can talk about this, that it's not very well known. I didn't know about it, which means other people probably didn't know about it. I'm just wearing something cozy and casual today, Alex. So what I can talk about, to be honest, is then I can talk about stop smoking, and then I can end that objective by saying there are also some HIV specific campaigns such as this. This is a campaign that encourages testing for a week. Because there's not really much to talk about. It is what it is. It's a week in February that encourages testing. There's not too much I can go into detail with. So I can end by saying there are some HIV specific ones such as this. This is what it does. This is why it was made. This is the benefits. This is the barriers. No, Zazu, we do not have to pay to test HIV. Unless we want it extra, extremely private. You know, if people want to do it very privately. Don't want any... if they're so intent on being discreet, they'll probably have to pay, yeah. But yeah, you can get it for free. Exactly, but if they have to pay, they're not going to do it. Okay, square one. Smoking mirror. Helpless. I got a mother's revenge. Can I get helpless? I am doing nurse practice. I'm already in university. Helpless, square one. I don't have square one. No, I do. Julia! Julia! Okay, helpless. Okay. Ending 5. Go back to on the loose. Where's on the loose? So guys, my mission is getting all of the endings. I think that's what I'm going to do, Zazu. Although actually, if I'm doing HIV, surely my focus should be on HIV specific campaigns. Don't know. What I could do is, right, I know what I'm going to do. I'm going to talk about the stop smoking, which is another general one. Then I'm going to talk about 2 HIV ones, such as the HIV testing week and then the opt-out within blood tests. But I have to keep it short and sweet because I don't have time. I don't have much time.
I had no choice. I had no choice.
I keep it short and sweet.
You're not the origami killer, Ethan. You're not responsible for those murders.
My?
I can prove it.
That changes nothing. Saving Sean is all that matters now.
Oh yeah. Wow, Zazie. Wow. No, Zazie, you are very right, to be honest, because I don't have time. I have 25 minutes, and I still need to do this part of this topic, and then I still need to do 2 more topics, then a conclusion, and I need to expand on my mental health and well-being, my well-being one. But to be honest, Zazu, that could have been good to say in the smoking one. But like you say, I don't... To be honest, I could talk about it if I had the time. I just didn't have the time. I need to go back to the well-being one anyway, because for the well-being one, I talked about the individual, and I did give some good points. You know, I talked about the individual, but I should also talk about the family. So I need to save time. I need to save time. And I should save time by going into specifics rather than general. Cool. Yeah, there was a well-being topic. Hi Alicia, привет! Привет, Lubię Bosia. Как дела? What am I supposed to do? Thank you, Mom, Zazu. Oh, it's too much pressure. Zazu, oh my god, I didn't tell you this either, Zazu. Zazu, I have an exam next month in November. Oh, thank you, Alicia, for passing on her hello to me. Can you pass it back to her? Zazu, I have an exam next month, and this exam is numeracy. And what that entails is medications. So numeracy in relation to medications, such as this patient weighs this much. How much medication will you give this patient who weighs this much? The next question might be, this patient needs 500 milligram of tablet, but the tablet only comes in 250 milligram. How many tablets do you give? So it's just numeracy regarding medication, and I need 100%. If I don't get 100%, I fail. Oh my god, hi Isidore! Oh, thank you, Cami. I'm gonna be a nurse. I'm gonna be a nurse. I'm gonna be a nurse. Yeah, I've got to get 100%, Zazu. If I get 99%, then I fail. As I need 100%. I need 100%. Only 100%. I can understand that because, you know, you can't make any errors with drugs or medication, can you? So it has to be 100%. I understand. Alicia, welcome home. I'll be streaming for 1, 2, 3, 4. About 4 hours? No, it's a failing grade, Zazu. Like, if I get 99%, I have to redo it. You have to get 100%. You have to get every answer correct. So it's not a written exam, it's a numeracy exam, so there's only one correct answer. So when it's like a written exam, you could, when you have to write answers, it's very variable, you know, there's different answers, but this is one answer. There's only one answer, you know, is it 37? Is it 39? Is it 50? There's one answer for every single question, and you have to get every single correct.
Ethan, I wanted to tell you, but...
What kind of article were you gonna write? My life with a serial killer? No. How I caught the origami
Because if I don't, I have to redo it. Otherwise, I get kicked off the course. If I fail it, I get kicked off the course.
Ethan, it's not what you think.
But I'm not going to fail.
You lied to me, Madison! All this time you fucking lied to me! I thought you wanted to help me, but you're only thinking of writing a fucking book!
It's also conversions, like what is 7,500 milligram in gram? That's...
And I knew that you were the father of the boy who had disappeared.
75 gram.
And I wanted to cover the story.
10.5
I saw
grams, sorry.
what you were going through to save your son.
Yes, you can, Zazu. You can use a calculator as
And
well.
I understood how much you love him.
So, for example, what is 427 milligram in gram?
I was afraid
4.27 gram.
that you may not believe me. I was afraid that you'd ask me to go. All I want.
But I think what the pressure is, Zazu, is it's 100%. What if I make a silly mistake, like a very silly mistake, like inputting the wrong number in my calculator? However, I will proof check every single question. So
I'm sorry,
I will do the exam and then I will go through it and then go through it again and just make sure I am getting the exact same numbers each time. I will very closely proof check my answers.
You're leaving, aren't you?
There's absolutely no reason.
It's the last origami.
There's absolutely no space to making a mistake.
I don't know where Sean is.
Take care, Ethan.
Thank you.
I can't lose you now.
What if I make a silly mistake? Zazu, you're naughty.
I'm gonna go find something to eat. Wait for me. I'll be back in 10 minutes.
Thank you, Zazu. I want to finish my assessment, Zazu, so then I can practice and focus on that, because my assessment is due on the same week as the numeracy. I think the numeracy is a day or two either later or before the hand-in. So I actually want to hand it in earlier so I can literally just focus on the numerous hand. Where did Urzador go? Exactly, I mean, I just have to really divide and times by 1,000 for the conversions. So for example, 1,000 milligram equals 1 gram. He's an Urzador. He's an Urzador. Hi Sky. Hi Sky. Hallo Maddie! Willkommen! My day is good, thank you. I'm making good progress on my assessment.
Cops.
Struggling to keep it within a time limit. But it's going okay, making slow progress. How are you? How's your trip, Mady? When do you go home? When are you going home, Mady Goo? How are you feeling? How on earth are you feeling? Oh. How on earth are you feeling?
Come on, what was the damn number? Come on.
That's true.
Pick up the phone.
I'll eventually reach the end, then I can focus on the numeracy
The
exam.
cops. They're in the motel. You've got to get out of here.
No, Zazu, it's literally one answer questions. So thankfully, no. But to be honest, we are able to half and split tablets if needed, Zazu.
Come on, he's getting away.
We can't crush them,
Still on the move. Get him.
and we should avoid splitting them, but we can.
He's on the balcony.
Fly back tomorrow. Oh, what are you going to be doing today, this evening then, maybe, and tomorrow morning? Are you feeling okay? Really? No, Zazie. Literally just answer the one question. How much of this do you need? How much of that do you need? Literally just answer the question. Come on, get me.
Don't move.
Says, are you going to report them? Are you reporting them? That's what Maddie would do because she's in Germany. That's what Germans would do. They would report them. Maddie, what plans do you have left? What plans do you have for the time left? You were walking so much the evening is over. Your sister wants to go back to a store tomorrow and the airport is far, far away. Really? How far is the airport? And what does she want to go by?
My son's gonna die. You gotta save him. Please, save my son. I beg you. You're his last chance. Save my son.
No. One hour 30. Oh gosh. So what time do you have to go to the airport for? Good, Sassy. Good. Because that's quite naughty. And you're naughty, Sassy.
Lauren?
I'm sorry, Scott.
You should have listened to me, Mr. Shelby. I told you to drop the investigation.
Your son is a serial killer. How many people does he have to kill before you turn him in?
Gordy has his faults, but he's still my son. You have no children, Mr. Shelby. You can't possibly understand. You leave me no choice.
Probably, Zazie.
Your
Would you drink from a
investigation
catheter?
is over. For good.
Mady, we was just discussing options. So, Mady, what do you think from a nurse perspective? So, basically, Mady, the question is... Oh, Mady, I'm sorry that you want to get home. Well, Mady, the question is... So, for my current objective, I have to talk about health promotions. So, what kind of health promotions are available in England? You know, there's a health promotion about not smoking, you know. There's promotions for stop smoking. There's promotions for drink less alcohol. There's promotions for exercise more. And these are very common and popular. these are very common and popular promotions, okay? So, do I talk about this, the common ones, that are just general, but... Sorry, I'm distracted. Do I talk about these general ones that are the most common and most universally known, or do I talk about a HIV specific one? Because I'm doing HIV. So do I talk about a specific HIV one, or do I do one that's universal, that most people know about, that's mostly applied in all of nursing? I ain't know. That's my question. Do I do one that's universal for all nursing, or do I do one that's for HIV specific? Because that's what I'm doing. I'm doing HIV. Okay, HIV it is. HIV it is. Zazu, I have to do HIV, you're wrong. Just kidding. That's what we thought as well. My topic is HIV. Because on one hand, I could do one that's universal in nursing. Stop smoking. Ugh. No, Mady. In the lesson, they gave us general ones, like I said. Stop smoking, exercise more. They would be good for stuff like asthma, diabetes. However, not really too much for HIV, really. I mean, I can link it, sure.
Yeah, sure.
But it's not specific HIV.
What are you gonna do?
So they're the ones but they give general ones. So these teachers, they're not teaching us about HIV. They're teaching us about general information about long-term conditions. So they're giving us the basic information that we will, I suppose, expand with our own condition we're talking about. So I suppose I should do HIV. There's just not enough time. There's not enough time. I'll stick with HIV. I need to go back into... So Zazu, the well-being question is question 2. And I need to go back to it. No, it's question 3. I need to go back to question 3 about well-being because I need to go into more detail. But I will do this one first. See, hi Susan. I hope you're having a good day so far. Susan, that's something I was going to talk about as well. But it can't be too personal. So I wanted to talk about... Although I suppose there's just not enough time either. There just ain't enough time. I think I know what I'm going to do. I'm going to do the HIV testing week, as well as opt-out blood tests, and then that's the question done. I could do the legislation, yeah. Legislation is where you don't have to disclose your... But that's going to be quite complicated because you don't have to disclose it, but you cannot recklessly transmit it. So, I don't know. Leave it to me. Leave it to me. I'll get it done. And then I'll work more on the mental health question. And then do the next 2 and do the conclusion and finish. Clinic like prevention you need. So stuff like education.
Stay back! Don't come near me!
Education regarding HIV.
Fucking asshole.
Please.
Hi Christophilus, how are you? And then I focus on the numeracy exam.
He's the origami killer.
No! No! He's innocent! He's not a killer! Not a killer!
Yeah, I can talk about stigma, Zazu, how stigma... I can talk about... Zazu, there's so much I can talk about. I can talk about how having the infection can cause mental health... I can talk about how having the infection can talk about health and well-being. Makes them ill, makes their body more vulnerable to infections. Maybe they will feel grief because they're not going to return back to normal, in quotes. Then I can talk about other people's beliefs on the virus, so stigma, discrimination, how that can affect them. I can talk about the treatment, so antiretroviral therapy, the side effects to that. You know, it might make them ill. Some common side effects are this, and this. This can make them sick. There's a lot I can talk about. Number 1, the infection itself. Number 2, the treatment for it. Number 3, the stigma around it. But then also I need to talk about family.
He was crying. He was so sorry for what had happened. Whatever he did. Gordy is my son.
Amazon Fire TV has so many great recommendations.
Oh my god, really, Christophilus? That would be cool.
Miss him.
What?
That boy, Gordy killed. No one will miss him. Just street trash, like so many others.
Oh, you disgusting pile of shit. And what about John Shepard? Why did you put flowers on his grave?
I own the construction site where he died. I never forgot. I've been putting
Exactly,
flowers on his
Zazie, but
grave
again, there's just not enough time.
John had a twin brother. What happened
I
to him?
had 25 minutes.
He was adopted, I think. His mother should know.
Her name is Anne. Anne Shepard.
You tell him, Zazie.
My heart! Heart! Quickly! I need my pills.
What does he have, angina or something?
Oh, there. Shelby! Come back!
Time to talk, Maddie. Because basically I have 25 minutes. In the 25 minutes, I need to talk about an introduction. So, welcome to my presentation. I need to talk about what is HIV. I need to talk about what is primary care. Then I need to talk about objective 1, 2, 3, 4, 5, 6, then a conclusion. So that's 10 different things, really. And if I give like 3 minutes each, that's 30 minutes. So it needs to be less than like 3 minutes each. It's just not enough time on my PowerPoint.
Miss, can I help you?
It can be, but not when I have all of these tasks.
Hello, I'm looking for Anne Shepard's room.
Please sign the visitor's book. Are you a member of the family?
Yeah,
That's
you
the
could say
format,
that.
Zazu.
Oh, she'll be pleased to have
Introduction. Because
No
the
one
whole
ever
module
comes
is
to see
primary
her.
care, Zazu. That's the module.
She has trouble remembering things.
So I need to
but
talk about
it'll
the
still
introduction.
please her.
Hello, this is the presentation, what the
It's room
presentation is.
19 at the
Talk
end of the
about
corridor.
what is primary
Thank you.
care in nursing. Then the condition I've chosen is HIV. What is HIV? And then the learning objectives. I mean, I should probably spend less time on those and more time on the learning objectives, because it's more important, really, I answer them in detail.
Hello, Mrs. Shepard.
Is it time for my pills already?
No, Mrs. Shepherd,
They're never on time with my pills. I don't know what they do here.
You don't know what they do.
The hospital are always on
You
time.
keep it that way. You keep it
Here.
ignorance.
I came to talk about your son, Mrs. Shepherd.
My son? I have no son.
Absolutely.
Your other
Zazuka.
son, Mrs. Shepherd.
Zazu, do you know,
John's
do
twin
you know what
brother.
Obama's last name is?
What was his name?
Kerr. Obama
What
Kerr.
other son? I have no other son. I never had any children.
I know what happened at Carnaby Square. Do you remember?
Carnaby Square. I think I used to live there a long time ago. We didn't have much money at the time, you know.
Sassy's
We
naughty.
had to make do with very little.
Obamacare. Or Obama
Try to
Express.
remember, Mrs. Shepherd. John's twin brother was placed with a foster family after the accident. What was the name of the foster family?
I asked them for a television, you know. They said I didn't have enough money. It's a
Aw.
pity. I'm fond of television.
Do you remember John?
My Johnny. He is a good little boy, you know.
Obamacare. Zazu. His last name's Kerr.
Mrs. Shepherd, your son may be linked to a series of murders. Perhaps you have some information that could help the investigation.
Mr. Peter,
you
right?
nurse?
Shall we sponsor a
Where are
TV?
my pills?
Hello, mister. How are you?
I think your son is in trouble, Mrs. Shepherd. He's done some terrible things. I need to find him. Do you understand?
Terrible things you're telling me. He never came to see me, can you believe it? In 10 years, never. No one forgets their mother, do
It's not a
they?
joke, Zazie. Okay, it is. I'm sorry.
You had a son named John, and John had a twin brother.
Do you have my pills? It's time for my pills.
How do you know that?
This woman might be the origami killer's mother.
She is.
Must be some way to get her to remember. Are these your
Obamacare.
children, Mrs. Shepherd? John and his brother? Is that them?
They're good little boys. Their father never looked after them. Always drinking. They didn't have an easy life, you know.
It'd take days, if not longer, to find the name of the family that adopted her son. Sean Mars would be dead by then.
Zazie, do you know how to do origami? Mr. Peter knows how to do origami, don't you, Mr. Peter?
All right, no point in wasting my time. I won't learn anything more by staying here. All right, no point in wasting my time. I won't learn anything more by staying here.
Oh! Mr. Peter, you naughty man.
Seems to be working. She's remembering stuff.
Mr.
Gotta find
Peter's
something else
naughty.
to show her.
Mady, what did you do today?
All right, no point in wasting my
In
time.
Japan?
I won't learn anything more by staying here.
What a lovely orchid. My sons loved orchids. We used to grow them in the back. When John died, I laid orchids on his grave.
Her memory is coming back. Don't stop now.
Don't stop now.
Just remember.
Zazu, don't stop now. Don't stop now. Zazu, don't go.
Oh, you know how to do these little dogs
Theme
too.
park. Oh my god!
My
That's
children
cute. Did you
love
go on any
origami.
rides?
I taught
Did you
them
go on
how
any
to do
rides
it.
or slides?
John loved the little dogs. He always wanted to call them Max.
Max,
Max, Max, Max. All dogs with the same name. I was
Zazu, you don't need
wasting
an
my
egg
time
muffin. You
telling
need a
him they
coffee.
couldn't all have the same name. But he always wanted his paper dogs
Copy.
Max. It's funny, isn't it? I cried when they told me. I'd already lost one of my children, and now they were taking away another one, you understand?
The foster family, Mrs. Shepherd. What was the name of the foster family that adopted John's brother?
They were really very nice people. I met them, you know. In the beginning, I used to go and see my little boy. And then I got sick and I couldn't go any longer. Perhaps he thought I'd forgotten him. He must have thought I didn't love him anymore.
His name, Mrs. Shepherd. What was his name?
But I loved him. If you only knew how much I missed him.
Please, Anne. His name. What was his name?
Come closer.
Mr. Peter. Oh, what did you eat, Mady? Mady Moodigo. Do you have like a hot dog? Gib Gib. Hello. I'm a student nurse. Gib Gib. Gibble Gibble. Gibble Kibble. Do you miss me, Gib Gib? Oh, that sounds good, Mady. Mady, have a look in Discord, by the way. Have a look in Discord.
There has to be a goddamn clue somewhere. It's probably staring me in the face. This kid's gonna die, and I'm going around in circles!
Thank you, Gib Gib. What's new with you, mister? How is everything? I hope the situation in America's
All packed up and
getting
ready to
better.
go?
What are you talking about?
The investigation's over. We know who did it. We no longer need your services anymore,
It's like
Norman.
Newman World.
So you can ride your files all the way back to Washington. I'd be lying if I said I was
I hope
gonna
Hello
miss you.
Kitty World doesn't have a meteor.
The investigation
Flood.
isn't over. You have absolutely nothing on Mars.
Mars is guilty. Case closed. Anyway, it's no concern of yours now. You're off the case. So pack up and fuck off.
Busy with what,
Blake,
Mr. Gib Gib?
You are an unbalanced, psychopathic asshole.
I'll take that as a compliment. Honestly, I don't give a shit what you think. I found the origami killer. Everyone's happy. End of story. Have a nice trip back, Norman.
Mr. Gib Gib. Yeah, did you... Maddie, have a look on Discord. Have a look on Discord, maybe. Gib Gib, have you missed me? Have you missed seeing me? Because I've missed you.
The killer's name is here. Somewhere in this
Dawson,
data, I
we're
just
gonna
have to
play Dead by Daylight
find it before
soon.
it's too late.
We're gonna play it soon, Mr. Origami. We're gonna play it soon, Mr.
One last
Origami.
thing, sir.
Origami Dawson.
You should be careful not to overindulge in you know what.
In the normal channel, maybe.
Very
General.
dangerous.
Missed you
It'll end
too,
up
Gib.
killing
Good to
you
see
if you're
you,
not
Rhode
careful.
Islander.
That would be
Oh,
most
thank you,
unfortunate.
Zazu. When am I gonna see you next? I'm streaming like once a week, twice a week if I'm lucky. So when will I see you next, Miss Zazu Maritz?
I can't go on.
Maybe.
I can't go on.
please. So I'm next streaming on Friday, and next week I think Tuesday. I only have one day off next week.
I'm gonna stay with you, Scott. I don't want to go.
Look, it'll only take a couple of days. Long enough to get this resolved.
I can't just wait while you confront my son's killer.
It's the only way, Lauren. Trust me. Now go stay with your mother for a few
Should we
days.
go, guys?
I'll come and get you when this is all over.
Tell me who the origami killer is. I want
Jazz!
to my son.
Ooh. Devin, hi, how are you? See you, Zazu. See you next time. Jazz says. Devin, it's me, your nursing student. How are you, Mr. Devin? How have you been? See, Zazu. Look, they're kissing. How have you been, Devin? It's been a while since I've seen you, mister. I've been busy with university.
I'll get help. Just hang on. Go on, hurry. I think the water's rising. I'm hurrying. I'll be right back.
I'm glad you're here too, Devin. What are you up to today? What does that mean, Mr. Gib? You're welcome. But what does it mean,
Mom's
mister?
work is too
Are you
far
being
away.
naughty?
I'd never make it in time.
Are you being naughty?
Gotta find someone. The water's still rising. John won't be able to hang on for long. Hold on, bro. I'll find someone. Then we'll come back and save
Devin,
you.
what coursework have you been doing?
Dad, it's John.
Thank you for the bits. Thank you.
Come on, John's gonna die.
You're naughty. Gib, when are you not naughty, mister? What's everybody having for dinner? I don't know if I should do pesto pasta or bolognese. I don't know if I should do pesto pasta or bolognese. Business! Oh my god. How long is your course, Mr. Devin?
I tried, John. I really tried. But he wouldn't come.
Bolognese.
Please don't die, John.
You think I should do bolognese? Bolognese. I can do bolognese. Yeah. Is it? That's good then, Devin. Why not? Get all those qualifications you can. Junmi! Oh! Junmi, yes! I think I can imagine you being a bit shy in Starbucks. I can imagine you being a bit shy in Starbucks reading that naughty book. But I'm glad you're enjoying it and you're reading it. Good, thank you, Devin. I've been good. I've been busy with school and working a lot on my assessments and revising, but I'm enjoying it. I'm finding it really interesting. Oh, ad. There's only one way to fix adverts. Forever Not Yours. Unfortunately, it has a happy ending. Well, not a happy ending for us, but for the two guys, they have a happy ending, which is sad because they don't deserve it. I still need to read Just Like You. I've got it right here. I stopped touching my lip, it's gonna hurt. Mate, did you have all the trophies yet? Do you have all the trophies in Transformers? Junmi, I have to agree. I agree, Junmi. I agree with you, yes. I don't think they should be happy. Oh. They have an unfortunately happy ending, Mr. Peter, which they don't deserve. Junmi, I like that idea. You can cheat on it with me on the cover, yes. Junmi, what about Just Like You? I haven't read Just Like You yet. Junmi, 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 Junmi. Is it good, Mayday? I haven't started it yet. I should. Junmi, 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 Junmi. Right. Right, you naughty lady. Did you complete all the trophies though? Did you gather all the trophies, matey? Oh my god. Did you get all the trophies? Me too, Junmi. I also don't like cheaters, Junmi. I also do not like cheaters. Mr. Peter, do you like cheaters? Junmi, I have respect for you. I too do not like cheaters.
Unless you touch, girl. Origami Killer's apartment.
Maddie, all the trophies for Transformers! And for the Up game. The game Up. Of course.
A cop's uniform. Always trust a cop. That's why children went with him. He was dressed as a cop.
Matey, you got all the trophies for Transformers. No, you beat Badder to it. Junmi, Badder really stinks. Oh! That's naughty, Mr. Peter. But how can you like them if they're cheaters? Because I think once they cheat, it just shows that they're very immoral and inconsiderate and horrible people. Yeah. Yeah. Natürlich.
How does this twisted fuck's mind work? Gotta be something related to his childhood.
What did he call those paper dogs when he was a kid?
Yeah, that's true, Junmi. I agree. My ex, who was cheating on me a lot, was very,
So you found my little...
He was putting on his
He
was putting his insecurities onto me,
All
thinking
those
I'm
children
cheating.
killed
I
just
wasn't
to find
cheating,
a
I was doing
father
no such
capable
thing.
of saving his
He
son?
was cheating, that's why. Turns out that's why he's being so insecure, because he was on cheating. I should have known. I should have known.
There's one child left. There might still be time to save him. Let him go.
Let
do
him
what your father
go.
couldn't do.
Mr. Dawson, and he is a Dawson. Yes, he is Dawson. Dipson, Dipson, Dobson, Dilson. Dimsum. I don't know. I think cheaters shouldn't be given the courtesy to be forgiven because they didn't give the courtesy to the person they cheated on. I don't think my ex will change from being a cheat. I think it's heartless telling someone you love them, sleeping next to them, when actually you're having sex with somebody else. I don't think anybody should forgive cheaters. Actually, I was talking to somebody, I suppose romantically. We was getting to know each other, and I was getting to know him, and I asked, have you ever cheated on someone, or have you ever been cheated on? Have you ever been cheated on yourself, or did you ever cheat on somebody? And he said he did cheat on somebody when he was younger, and I was immediately turned off, and I stopped talking to him. I thought that is so ugly and unattractive. I don't want to continue talking. And I think it was a few years ago. They said it was when they was like 18, but no, I thought that was really unattractive. Exactly. As Gary would say, facts. As Gerber would say, facts. But hopefully nobody will ever be cheated on. Again, if you already have been. If you already have been, don't cheat on again. Mr. Peter, can I ask you a very personal question? It's very personal. So you said you're in a relationship, you're in a side relationship, right? I think you side. Was it always like that, may I ask? Or did it develop into that when you found what's most comfortable for you both and works for you both? Or was it always like that? Cute. I've nearly got the platinum trophy. I've just got to do one more run through and then I get it, I think. Only did by daylight. Dobson, Dipson, Dilson, Dipson. Dimsum. Yet developed. When we were teenagers, we tried the things. Okay, something that was more effort than it was worth. and then so now and then, and by the time we're in our 20s it just stopped completely. Well, I'm glad it works well for you both, and I'm glad you're both happy. That's the main thing. Relationships really are a lot more than sex, really. And how long have you been together?
The origami killer has taken a 9th victim. The body of Sean Mars was discovered this morning on wasteland north of the city. The officer in charge of the investigation, Captain Leighton Perry, has resigned this morning. Our main headline today: it is reported that the police have identified the man thought to be the origami killer. Scott Shelby, 48, is a former police lieutenant who claimed to be a private eye.
21 years. That's so sweet. Why don't you try it, Mr. Peter? Why not? Try it. Try it, mister.
In an effort to arrest him.
Maybe you'll enjoy it once in a while. If you're both up for it. If you've realised he's not the origami killer, why is he still in jail? You realise he's not the origami killer, let him out. Alma, thank you for the vid. Thank you. Oh, Alma, bless you. I miss playing Minecraft with you too. Do you want to play Dead by Daylight with me? When can I next do Minecraft? It's been a while. I should do Minecraft again, I should. I'll do my best to try and feel it in the next coming weeks. But do you want to do Dead by Daylight with me? Mr. Peter. Maybe have a discussion with him. Maybe, you know, consider it like... not really... Oh, that's not really nice to say. Favours? You know, this is something you want to try. What is something he wants to try, and you'll both compromise and support each other in testing the waters?
Matt? Sam? I'm worried about you, girl. You haven't answered your phone in days. Listen,
I think actually, to be honest, many people think like that, Christophilus. I think many people think like that. Some people think sex is just sex, like you say. Some people think it's more intimate. I think sex is very intimate.
I'll try again later on.
When yeah, I think sex is very intimate. I think you put a lot of trust into somebody to let them actually touch you and inside you. Thank you, Alma. Alma, when I do my next subathon, we'll do Minecraft for sure. I really do have to play it because it has been a while, and District 5 is waiting for me.
Try to forget.
But I don't know if it's the Halloween event in Dead by Daylight. It might be because we're pretty close.
Part of your plan to forget. It's the most effective way I found. Except it's not a solution. For the moment, I'm not looking for solutions.
MRPETAH.
I'm afraid things may have affected you more than you think. Why do you say that? I'm okay.
Aww.
I'm getting through this.
Oh, Mr.
I
Peter.
shall take it easy.
Aww.
See what happens when it's all over.
So you're two very opposites.
It may never be over, Norman.
I personally wouldn't like an open relationship because the way I see it as well, I'm a bottom, so naturally it comes with a lot of preparation and effort. So if I'm in a relationship and I have a boyfriend and I spend a few hours in the bathroom prepping, that's hours taken away from him. Why would I go to the bathroom, put in all that effort for somebody else when I could be spending it with my boyfriend? I think that makes sense. Or why not be in the bathroom prepping and then give it to my boyfriend?
None of the families of the victims ever hired you, did they, Scott? I called every last one of them.
That takes a long time, Christopher. And shaving,
All
and
you did
showering, and then traveling.
was collect the evidence you'd left behind. Wipe
Your
out your
morning person
past.
if you wake him, he wants to do things on an evening, and after 2
the
p.m.
misery of the
he starts
parents
to
whose
notice.
children you'd killed.
We are each other's best friends. Oh, that's really sweet.
I swore.
So
on
you're
my
a
son's
morning
grave
person.
that
What
I would
time do you
kill
wake
the
up in the
man who
morning?
murdered him.
He punches you if you wake him up. I don't like being woken up. No, don't worry, Christopher. You can ask anything and
I'm a father too.
answer. Yeah, as a bottom, shave. Douche, of course, which takes a while. Also, travel. Gib Gib. Is there a song with that name? That's dirty. Well, you put up with each other for all this time, Mr. Peter, so it must be love. It's dark at 7:30, but yesterday you've been to the gym. Ooh! Yeah, you convince yourself, Mr. Peter. No, I'm surprised Em hasn't really been raving about it. Have they? I wouldn't say I'm a morning person, no. I'm not a night person either. I get up and sleep early. I sleep early. I go to bed early and wake up as late as I can. As late as I can. Depending on the day. Today I woke up at like 8:30. That's dirty, Gib. And Mr. Christophilus, that's naughty too. Is Taylor Swift quite naughty now? Less judgment. Mady was the lead game builder of this game. My lip is so irritable. It's Cecilia, Virginie, Emily, Sylvain, Sebastian. That is so true, Gib Gib. Tiffany. The music is loud! What music? Okay, I can turn it down then. Is that better? Cheese. Cheese is vile, isn't it? Alright, don't shout at me. Is that better now, though? I hate cheese. Cheese is disgusting.
Hey everybody, I'm Jurassic Force.
Cheese is disgusting. Blech. No, Mr. Peter, it will ruin it. Sorry guys, I'm just looking on my computer, by the way. The hold music. What hold music, Susan, sorry? The hold music video. What's that, sorry? Sorry, Susan. Maybe I can change that. You mean the countdown? I can change that right now. Is that better? Devin, where on earth did you go? Is that better? Where on earth did you go? Well, welcome back, Devin. There we go, Susan, all sorted. Ah, Mr. Peter! Thank you! Thank you, Mr. Peter, for gifting 10 subscriptions. Thank you, Mister. Ah, that's amazing. Thank you, Mister. Thank you so much for supporting me and also gifting subscriptions to viewers on my stream. Devin got one! Nice! Thank you. Here we go, guys. Now, we've got one more to do, okay? Chapters, and we need to go to Killer's place. One more. Thank you, Mr. Peter. Right, go to Killer's place. Maddington gets the address. Thank you, Devin. Aww. Thank you, Mr. Peter. That's very sweet of you to say. Thank you. It's the least I can do. Especially when you treat me with such kindness, too. Devin. How much more of this coursework have you got to do, Devin? Devinga. So guys, after this I'm going to do Dead by Daylight. Mr. Peter, how's your day going, by the way?
Lots you touch, girl. The Origami Killer's apartment. There must be something that'll tell me where Sean Mars is.
I wasn't going to do some tonight, but I think I will. Because I got loads to do. The sooner I finish it, the better. Right.
Cop's uniform. Always trust a cop. That's why children went with him. He was dressed as a cop.
And she does. Mazen gets the address. And escapes. Hang on, guys. Bear with me. Nice, Devon. So it was worth it. I suppose that's what I gotta do. Although I keep finding myself finishing an objective and then do the next one. Oh my god, are you both working from home? Hi, Aunt! Working next to you until 6. He's been quiet. He works on calls. Introducing interesting, which is chilling. That's interesting enough, no, Mr. Peter. Have you finished work?
This is where he cultivated the orchids that he left on the chest of his victims. Shit, he needs a password. Got it. Max. The name John gave to his paper dogs when he was a child. What the hell is that? An address. It's gotta be where Sean Mars is.
Roosevelt
Hurry.
Road.
There's no time to lose.
I know what you mean, mister. You could be a bit more productive if you wanted to. But no, I think you should stay here.
So you found my little secret?
Oh, and you have a good day at work?
All those children killed just to find a
What did you
father
have to do today at
capable of
work?
saving his son?
Shut up!
He told us to shut up.
There's one child left. There might still be time to save him. Let him go. Do what your father couldn't do.
Alyonka, привет, как дела? Let him go. Mady, would you let him go? Harrogate, checked car over, drove to York, checked 3 cars over. Oof, a lot of driving. Wow. And what's for dinner for you and Aunt tonight? And you get paid for the driving, right? Let it go. Marilyn Manson version. Marilyn Manson version, maybe. Wow. Why are you thinking that? Oh, because you would not kill. You would not let the son. You would not let the kid go. No, not Sue. He's skinny. Perhaps being skinny, whatever we want. Oh, I'm gonna eat dinner later tonight and then work on my assessment, see if I can get this outcome done. At least 2 outcomes, plus add to my 3rd outcome, and then a conclusion to be done. Cool. And then I can start revising some more from year 1 again. I've not done that in a while. So I'm focusing on my assessment. Also, sorry Shiny Diamonds, I've not been revising with you guys. Doing this assessment, I need to do it alone because I need peace and to focus. See ya, Dina! Mr. Peter gifted it! Thank you, Mr. Peter. R-P-E-T-A-H. Devon, you would be a distraction, I'm sure. Thank you, Alyonka. Alyonka, how have you been? How is everything? This is what I wore to university yesterday. This is the last thing I have to do for the trophy. Oh my god! On Monday! Oh my god, congratulations! Fingers crossed! Oh, fingers crossed. This is good news. Fingers crossed that this will lead to further good news because you deserve this. Oh, Congratulations and good luck. Best of luck for Monday. Yeah, Mr. Peter, that's yeah, my numeracy exam. Yeah, I've got to get 100%, otherwise I fail.
I know where Sean Mars is. No time to call anyone.
Fingers
I'm on
crossed.
my own.
Please. Thank you, Dina, and so have you. We've got this. We've got some good things coming up. We'll manifest it. Good things coming up. And thank you, Devin. Actually, that's what I need. I need to stop being distracted and procrastinating. This numeracy exam, I need 100%. If I get 99%, it's still a fail. I can't get anything other than 100%. I have a few tries. I try once, then I can try again, then I can try again. But if I fail that third one, I get kicked off the course. Oh, I'm watching you. Oh, that's so cute. Uncle Nurse Rock, that's so cute. Oh, he's a nurse. Yeah, no misbehaving in front of a nurse. Oh, that's cute. And you have baby names picked, right? So cute.
There's nobody around. Shelby must think I died in a fire. Let's hope I'm not too late.
Just a little. Again, nothing you wouldn't do.
Sean, hang on.
Haha, Devin, you funny. Tell us. I think you might have already told me the baby name, but you can remind us. Thank you, Mr. Peter. Your mum is a career nurse. She's just about to retire. Oh, which says the hardest thing is doing the pills because you can't make mistakes. Exactly, and as she's gotten older, obviously her mind isn't sharp. That is so true. That's why we need 100%, because you cannot make mistakes. Thank you, Mr. Peter. Tell I said hi. But absolutely, yeah. That's why we need 100% on this test, because you cannot make mistakes.
Only his father can save him. For years, I hoped a father would sacrifice himself to save
Samuel.
his son.
Levente. Oh my god, that's a nice name. Levente? 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 Lucy and Hannah were the girls. Oh, that's really nice. Oh, I really hope it works out. Really works out. So if it works out, October, November, December, January, February, March, April, May, June. Oh, kind of like mid-July. Summer, baby. Christopher, welcome back.
I know what you went through, Scott. You lost your twin brother.
It really, yeah. Well, thankfully you won't have to go through all of the summer pregnant as well, because that's going to be tough.
John and I were like one person. When he died, it was like a part of me died with him.
Father was an alcoholic. He was just some poor guy who was so messed up with alcohol that he couldn't save his son.
You know nothing about what happened. You hear me? Nothing.
Choose, man. Enjoy your last day tomorrow. Your last morning, okay?
Punching bag for
Adina, that's horrible. That's horrible. Typical Twitch stream. That's horrible.
I understand you, Scott. There's nothing harder than not being loved by your
I'm trying to get the platinum trophy. This is the last ending I need to see to get it. Oh yeah. Choose. Enjoy your last morning tomorrow. Can you just not get out? That really sucks. Typical Twitch stream experience. But that's what happens with games like this and Until Dawn as well. People just spoil it. My favourite ending. The one with the happy ending. Although this one's interesting because I haven't seen this one. And that's true. How did he stay afloat if he's not really motionless though? How did he stay afloat? You need to do 2 rescue breaths. You should have started with the rescue breaths. 5 of them before you did CPR. Well, that's so true, isn't it? Bodies do float. True. But then he should have drowned because his face would have probably been like his head would have like hung, so his face would have been in the water surely. Although that's probably what happened. He probably did drown because you just had to give him CPR. Ouch! Ouch! I've never been in a submarine. He's gonna beat me up now. Yeah, just floating like a seal. Who's he gonna go for? Me or the kid? What? Ow! Shoot! He shot me. Oof. Oh no, don't shoot! Don't shoot! What? Oh shoot. Where do I go? Has anybody else got in this ending? This is the first time I'm getting this ending. Oh, he shot me again. I'm gonna get stuck. Go! Go! Climb! Oh, ouch. Climb! Climb! Go! Oh my god. Now jump on him. When he's climbing, jump on him and land on him. That's what you should do. Get really high and then fall down and jump on him and land on him. Actually, that's probably not worth the risk. That's gross. I ain't do stuff like that. Or I can pee. I'll start peeing and all my pee will trickle down on him. That's not a bad idea. I didn't know there was this ending. This is a whole nother ending. Ah! Ouch. Oh my. Mr. P, you're funny. True. Oh! Ow! Oh god. Bye.
Please, help me.
Okay, we'll help you. Let's have a timeout.
Oh, that was close.
He's gonna attack me. Oh. Oh, สวัสดีครับผมรักกบมากๆครับ Ouch. Like a sardine. Like a sardine. Yeah, that's true. That wouldn't have killed him alone. Origami. Origami.
As police commended the courage and tenacity of Madison Page, a reporter covering the Origami Killer story. Miss Page,
Yeah, but he flopped like one, didn't he?
Successful resolution of this case. Our main headline today.
Ugh.
It is reported that the police have identified the man thought to be the Origami Killer. Scott Shelby, 48, is a former police lieutenant who claimed to be a private eye hired by the families of the killer's victims. Shelby was killed during a massive police operation, but further details have not yet been released to the public.
Is he out of jail?
You're free to go.
Sean has been waiting to see you for weeks. I thought you might like him to be here as soon as you got out.
Why isn't he out? Why did it take weeks to get out?
Ethan, I'm sorry.
Promise you'll never leave me again, Dad.
I promise, son. I never will again.
Our next guest is rumored to be about to receive a Pulitzer Prize for her remarkable series of investigative articles about the Origami Killer case. Showing incredible courage, her daring intervention led to the arrest of the country's most wanted criminal and
Oh, arrest. So he didn't die.
This evening, I welcome a woman who might well be the true definition of a heroine for the ages, Madison Page. Good evening. Thank you for agreeing to talk with us. Now, you've been described as being both determined and tenacious. Two qualities, no doubt, that were needed to see you through the dark hours of this unbelievable story. Were you afraid at any time?
Probably were, yeah. Christophilus, have you ever eaten sardines? I haven't.
I really admire you for what you've done. Thank you.
For John, please. We need more journalists like you, Miss Page. It's a good thing you were there to catch that bastard.
Thank you.
Oh my god, really? You eating sardines?
What's your name?
Vincent. Excellent investigation.
Sardines with what, Miss Adina? Mrs. Oh, I like cod and salmon, yes.
Somebody more.
Actually, that's the only fish I eat too. I don't eat tuna. Sardines and toast. Toasty.
Are you sure you've thought this through, Norman? You've got a promising career ahead of you. It's a pity that...
With all due respect, sir, I'm done thinking. I need to lead something like a normal life. I've just got a bit too close to everything recently. I need to step back. At least for a while.
Will you be coming back to the FBI?
FBI.
No. I'm making no promises.
You can keep your Ari if you like. This one's going offline. There's a new model due next month.
I think you better take it back. It's just a little too compelling, but it won't help me where I'm going. The real world.
He's going to the real world.
Whatever you want. I hope you find what you're looking for, Norman.
I hope so too.
Ooh. Oh, Lauren.
You killed my son, Scott. Were you thinking about that when you held me in your arms?
Oh, have you held a gun before? I bet you have actually, haven't you, you army man?
I don't know why you did all this.
Oh, Lauren.
Nothing can justify it anyway.
Salam!
Nothing but contempt for you.
Salohi.
Nothing but contempt.
Salohi. Silohi. Salam Silohi. He shouldn't be buried like that. He doesn't deserve a burial like that. This is Heavy Rain, Mr. Salohi, you naughty man. Silohi. I remember off You Soldier of a Man.
I want to see them again. I'm a father too.
You Soldier of a Man. Not yet, Christophilus, no. I've been focused on my schoolwork, really. When I don't stream, I don't really game. It's close, Silohi. It's close. It's, Heverin. How was the meeting, Sky? How's your back? Is the music too loud again, by the way, guys? And Arma, have you finished work yet? Boetic, King Boetic, King Boetic. Salam Boetic, Boetic. Back is fine for now. Well, may it stay that way. I think they're such similar games. Trip from Human. Heavy Rain, Until Dawn, similar, but again, I think different. Damn. But yeah, they are similar. I really like these games like this. Ah! Shakran! Let's go! Let's go, Boetic! Shakran! Are you being a pirate today, mister? Although you always are a pirate, aren't you? Are you on the sea today, Mr. Pirate? Boetic. Oh. I should do Detroit Become Human and get the platinum trophy for that. Oh, I don't think I'm... Let me see how far I am. I'm not too close with the platinum trophy for that one, unfortunately. Trophies. Detroit Become Human will be far down. Beyond Two Souls. Hi, Purple Joker. How are you? Hi, Purple Joker. The Triple Become Human. 52%. Not bad. Ahabek, Boatik. Ahabek, Ahabek. Hi, Jill. How are you? Happy Tuesday, Jill. Oh, I love Detroit Become Human. I should play that next. Thank you, Jill, for gifting Purple Jacob the subscription. Jill, how's your week going so far? How are you feeling? Baby steps. What's baby steps? I've not even heard of that. Baby steps. Baby steps. Getting over it. It rings a very slight bell, but I can't say yes, so no. Unfortunately, note. It's a rage bait game. Who by? Off! What are you talking about, you dirty man? Off! What are you talking about? Oh my god, so it's like a surgeon simulator as well. That was horrible. Quop. You're like quop, Purple Joker. On the game or by the player? Have you played Thank Goodness You're Here? Teresa recommended that to me and I've only, not too long, completed that and got the Platinum Trophy for that. Oh my god, okay. Is it on PlayStation? How have you come across this naughty game? That was funny, wasn't it, Mr. Peter? Oh my god, they're in London! They came for the American football game and will be there for another week. He's then going to Italy. How amazing! I hope they're enjoying their time in London, Jill. Are they enjoying themselves? Are they eating some good British food? How cool. Oh my gosh. I hope the weather's behaving up in London. Okay, so. I might have to give it a try then. Although I might blush with the cursing. You know me. Oh, NFL. That's American, isn't it? Julia, what? Who's sick? Who is sick, Julia? Are you okay? Yep, fish and chips, exactly. As long as they're enjoying themselves. You have to make the most of this weather, unfortunately. But I'm glad they're enjoying. Have they had fish and chips yet? Also, thank you guys for starting the hype train. It's always nice to have a hype train. No, we should get the platinum trophy. Hi, Nicholas. How are you? It's been a while. Are you okay, Nicholas? I didn't get the trophy. So what endings am I missing? Oh my god. Julia, please don't you get sick. Everybody around you is sick. Don't you get sick. Pie mash with eel. Eel? I didn't get the trophy. They won! Congratulations! Why didn't I get the trophy? Julia, don't be. It is homophobic. I think I know which one I haven't got. I think I don't have a new start. I have a new start. Thank you, Jill. Thank you for the bits. My mum's good, thank you, Nicholas. How are you and your mum? Yeah, I agree. Do I have a new life? Do I even have a new life? We have a new start. Where's a new life? A new life. We don't have a new life, do we? A new life. Oh. I know what I need to do for that one. Hurry up then, Adina, please. Hurry. A new life. Thank you very much, Mr. Nicholas.
Ethan, are you all right?
Are you all right? No, I am all left.
I killed a man. I had no choice. I had no choice.
You're not the origami killer, Ethan.
Adina?
You're not responsible for those murders. I can prove it.
What? What was? You are bad. You're bad.
Sean is all that matters now.
You're bad. Are you alright? No, I'm all left. How is that's amazing! That's a really good joke. That's the best one of the best jokes I've ever heard. I remember the woman who said that on, like, it was like Britain's Got Talent or something, like a talent show, and she wanted to do comedy. No, you're all left. Off and get excited. Don't get excited, awful. Devin, where do you keep going? No, Mr. Peter, sorry. Not this time. Come on, guys, get over it. Get over it. Was you doing naughty stuff, Devin? Is that what kind of distractions you've been having? Ooh. What's off doing to you, Julia? The naughty man. Off, what are you doing? Purple JK. Is that what you're wishing for? Hi, Ash. Oh my god. None of us approve of this. Not even the women or no one approves of this. Right, guys? We don't approve of this. You're all LGBT allies. But hi, Ash. How are you? Ooh. Shadow Victory Bell. Off. Have you kidnapped her? Oh, Pepper Joker. Ash, what are you going to do today? Awful. AOFFLE. Christian, I miss you on OnlyFans. You should come back, mister. Nicholas, what is that thing next to your name? Raging Wolfhelm. What's everybody having for dinner tonight? I'm not sure. Is sardines and toast your dinner, Edina? Are you 2 hours ahead of me? Is it 11 past 5 in Hungary? Devin, I definitely recommend yes. Yes. Nicholas, please, come back. I miss talking to you there. Oh, Julia, he gave you candy, so it was worth it. You're funny, Devin. You're funny. Is it? Oh my god, you've got it too, Ash.
All this time and I had no idea.
Uh-oh.
Ethan, what's the matter?
I thought I meant something to you.
Listen.
Yeah. What kind of soup, Julia? You're gonna have the soup as well.
Good nurse for a fucking journalist.
Ethan, I wanted to tell you, but...
What kind of article were you gonna write? My life with a serial killer? No. How I caught the origami killer. Maybe you'll get a book deal. I hope it was fucking worth it.
Ethan, it's not what you think.
You lied to me, Madison! All this time you fucking lied to me! I thought you wanted to help me, but you're only thinking of writing a fucking book!
Did you at least give her the candy she likes off? Nice candy that she eats.
It's true. I'm a journalist. And I knew that you were the father of the boy who had disappeared, and I wanted to cover the story. But then I saw what you were going through to save your son. And I understood how much you love him. I wanted to tell you the
Julia,
truth,
will Dead by Daylight make you
but
feel
I
better if we play?
I was afraid that you may not believe me. I was afraid that you'd ask me to go.
Yeah, I was, Ash.
All I want
Yeah, I was.
is for you to find your son alive. And when it's all over, I want to be with you.
Ooh.
sorry, Ethan.
She wants to be with him.
Sorry. You're leaving, aren't you?
It's the last origami figure. The last letters, then I'll know where Sean is.
Take care, Ethan. I can't lose you now. I'm gonna go find something to eat. Wait for me. I'll be back in 10 minutes.
Off!
I think I'm starting to fall in love.
Hiya.
Now we gotta find his son. And I think I know where to start looking. I was so afraid he wouldn't believe me. Wrong move, idiot. I should have admitted everything earlier. We'll find his son and prove he's innocent. I'll be able to help him.
I'm good, thank you. I'm happy to see you. How are you, Mr. Off? Awful. Nice to meet you, naughty Off. Off, why are you panicking? Is it because you got Julia in the back of your car and you don't know what to do?
They're looking for Ethan. It looks like a raid. There must be some way of warning Ethan. Think, girl, think. A telephone. I gotta find a telephone to call his room.
Come on, what was the damn number?
207.
Come on.
Off.
Come on.
Nice to meet you, Panic.
Pick up the phone.
Hello?
The cops. They're in the motel. You've got to get out of here.
Off. The cat centipede or animal centipede? Wee. Oh, did you see the animal centipede or the cat centipede? Nicholas, please hurry, okay? Please hurry. Off. Do you like... You could have a pet centipede. The centipede can be your pet. Sorry, mister. I'm sorry. The centipede can be your pet off. Pet centipede. Off's pet centipede.
Lauren?
I'm sorry, Scott.
You should have listened to me, Mr. Shaw.
Good morning, Teresa.
I told you to
Do you sleep okay?
Your son is a serial killer.
How are you feeling?
How many people does he have to kill before you turn him in?
Gordy has his faults, but he's still my son. You have no children, Mr. Shelby. You can't possibly understand.
No, thank you, off. What have you got planned for today, Teresa, if you don't mind me
Your
asking?
investigation.
If you're okay sharing, you don't have to share.
For good.
I can imagine, bless you. Are you with anyone today? You're not alone.
Lauren! Shit!
Awful, 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 awful. It's okay, thank you, Teresa. Yesterday was really interesting. Yesterday was interesting. We learnt about sickle cell disease and thalassemia. Still working on my assessment. A lot to be done.
Lauren! Lauren, wake up!
Oh! Why? What? Whoa. Oh my god, LA Noire! I should play LA Noire as well. Thank you, Ash. It's going really well. I'm really enjoying it. I'm really enjoying it and I'm finding it very interesting. LA Noire.
I was gonna take up swimming again. This isn't exactly what I had in mind. You got a car back at your place? Mine's obviously pretty fucked up.
Yeah, sure. What are you gonna do?
I'm gonna go settle a few scores. Come on, I'll take you home. Lock your doors and windows and don't let anybody in but me. Okay?
Be careful, Scott.
Okay, was it a poisonous one, do you think? I think it was a poisonous one, Mr. Awful.
Don't try to...
Off, your safety is important, mister.
Where are you, you old bastard? Your office?
Oh, off, you don't want that, please. No, off, you don't want that, please, do you? Saliho. Of course you can, Saliho. Salejo. Salahi. Saliho. Salohi. Salohi. I keep saying your name wrong. Salohi. Selohi. Of course you can, Selohi. Give me a second, Selohi. Selohi. Selohi.
Please, don't hurt.
Hiya. Selohi.
Your idiot son killed all those kids, didn't he? He's the origami killer.
No, he's innocent.
Thankfully not off, and I hope never. Thank you, Cammy. Cammy, you charm, are you working today, mister? Are you working today, Cammy said that? Off work to the 28th. Oh my god. Very nice, Cammy. Are you home from your holiday? Yes, it is, Cammy. Been there. Have you been there before, Mr. Devon?
Gordy always wanted his fun, you know.
Welcome home, Cammy. How was your trip?
To be like the origami killer.
Kokomat Makarov. You're the naughty one, though.
Held him under the water for a little too long. It was an accident. An unfortunate accident.
Amazing. I'm glad Kami said that.
He told me everything.
Mr. Kami said that.
He was
Poznan.
crying.
Remind me,
He
where's
was so
Poznan?
sorry for what had happened.
Remind me where that is. You've already answered before, but I forgot.
Gordy,
Sorry about that.
Gordy is my son.
Poland. Is it for the weekend you're going? Be safe, Kami. Have an amazing time.
What? That boy, Gordy killed. No one will miss him. He was street trash, like so many others.
Oh, you disgusting pile of shit.
I don't have one planned, Kami, but I'm thinking Serbia for a few days, maybe. But I haven't got any planned, of course, because of my university. And my schedule.
I've been putting flowers on his grave for 30 years.
John had a twin brother. What happened to him?
Then I'm going to
I
Kosovo
don't
after
know.
sometime.
He was adopted. I
Back
think.
home.
His mother should know. Her name is Anne. Anne Shepard. My heart!
And Shapodi.
Quickly! I need my pills. In that drawer. There. Shelby! Come back! I fucking order you! Come back!
Ordering someone to come back. Like, shouting like that. Probably not gonna. My next break, Teresa, is I get 2 weeks for Christmas. 2 weeks for Christmas, so I'll be at home for Christmas, of course. But then I might be able to start placements a week early, and if I can, I'll do that. Then I get 1 week off in March, again, which can be used for placement, catch all my hours, and then 3 weeks in August. No, in September, sorry, next year. Which again, I can use to catch my hours if needed.
To have a visitor. No one ever comes to see her.
So I can either have a break or catch up more hours to get closer to finishing.
You know.
Lukush.
It's room 19 at the end of the corridor.
Thank you.
Only a few hours left before Sean Mars dies.
Yeah.
Hope I'm not wasting
Exactly,
my time.
Cammy. That's very important.
Room 19. Where is that? John Shepard died 30 years ago. Hope his mother has all the answers to this puzzle. Room 19. Where is that?
Here.
Hello, Mrs. Shepard.
Is it time for my pills already?
No.
No, Mrs. Shepard,
They're never on time with my pills. I don't know what they do.
It really is. It's a real,
The other
it's
hospital,
a
they're
real
always
stump
on
and barrier, isn't it, Cammy? People don't
Yeah.
realise just how bad it is. Absolutely.
I came to talk about your son, Mrs. Shepard.
My son? I have no son.
You have a son.
Do you remember John?
My Johnny. He is a good little boy, you know.
Your other son, Mrs. Shepard. John's twin brother.
Yeah, it's
What
not
was
nice,
his
is it,
name?
Teresa?
What other son?
Especially when the employers don't help.
I have no other son. I never had any children.
You had a son named John, and John had a twin brother.
Do you have my pills? It's time for my pills.
I know what happened at Carnaby Square. Do you remember?
Carnaby Square. I think I used to live there a long time ago. We didn't have much money at the time, you know. We had to make do with
Yes,
very
off, especially
little.
if she's not complying.
I think your son is in trouble, Mrs. Shepard. He's done some terrible things. I need to find him. Do you understand?
Terrible things you're telling me. He never came to see me, can you believe it? In 10 years, never. No one forgets their mother, do they?
Mrs. Shepard, your son may be linked to a series of murders. Perhaps you have some information that could help the investigation.
Are you a new nurse? Where are my pills?
Try to remember, Mrs. Shepard. John's twin brother was placed with a foster family after the accident. What was the name of the foster family?
I asked them for a television, you know. They said I didn't have enough money. It's a pity. I'm fond of television.
We gotta get her a television. See you, Teresa. You take care and get a good rest. And if you need me, I'm here.
Are these your
Just
children,
take care.
Mrs. Shepard? John and his brother? Is that them?
They're good little boys. Their father never looked after them. Always drinking. They didn't have an easy life, you know.
Off is so naughty. He is so naughty, He is so naughty. I don't understand how all can be so naughty. Because he is a naughty man. And he's taken Julia. He's kidnapped her. Not too rough.
What a lovely orchid.
It's the origami killer's
My
mom.
sons loved orchids. We used to
It's
grow
the
them
origami
back.
killer's mom.
When John died, I laid orchids on his grave.
Her memory is coming back. Don't stop now. Just remember.
Off, hurry!
Oh, you know how to do these little dogs too. My children loved origami. I taught them how to do it. John loved the little dogs. He always wanted to call them Max. Max, Max, Max. All dogs with the same name. I was wasting my time telling him they couldn't
Purple
all have
Joker,
the
purple
same
Joker.
name. But he always wanted his paper dogs Max. It's funny, isn't it? I cried when they told me.
Uh-oh.
I'd already lost
What, hold your
one of my
hand?
children, and now they
Hold
were
your
taking
hand.
away another one, you understand.
The foster family, Mrs. Shepherd. What was the name of the foster family that adopted John's brother?
They were really very nice people. I met them, you know. In the beginning, I used to go and see my little boy. And then I got sick and I couldn't go any longer. Perhaps he thought I'd forgotten him. He must have thought I didn't love him anymore.
That's exactly how he felt.
His name, Mrs. Shepherd. What was his name?
But I loved him. If you only knew how much I missed him.
Please, Anne. His name. What was his name?
Come closer.
I'm like, I ain't doing that. No. Do 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 do. Off. Do you need us to hold your hand?
The last origami figure. The last trial. The last origami figure. The last trial. The last origami figure. The last trial.
Oh, you got it, Purple Joker. So, do you often have people hold your hand then? You must do that very often. You just sound like someone who takes many poops.
The last question. Are you prepared to give your life to save your sons? There is a deadly poison in this vial. It will kill you in exactly 60
No,
minutes.
don't kill me.
If you drink it, you will get the last letters of the address. You will have enough time to save your son and say goodbye to him, but then you will die. You can drink the vial or decide to leave. The choice is yours. The last letters have been sent to your phone.
I did what I had to, Sean. Your dad's
He
coming
did.
to save you.
He did what he had to do.
We've only got a few more hours left to save Sean Mars. There has to be a goddamn clue somewhere. It's probably staring me in the face. This kid's gonna die, and I'm going around in circles!
All packed up and ready to go?
What are you talking about?
The investigation's over. We know who did it. We no longer need your services anymore, Norman. So you can ride your file all the way
Norman.
back to Washington. I'd be lying if I said I was gonna miss you.
The investigation isn't over. You have absolutely nothing on Mars.
Mars is guilty. Case closed. Anyway, it's no concern of yours now. You're off the case. So pack up and fuck off.
Blake, you are an unbalanced, psychopathic asshole.
Oh, welcome back. You didn't fall into the toilet.
Honestly, I don't give a shit what you think. I found the origami killer. Everyone's happy. End of story. Have a nice trip back, Norman.
Off didn't fall into the toilet. Basically, it just means you're naughty.
Somewhere in this data, I just have to find it. Find it before it's too late.
Oh, one last thing, sir. You should be careful not to overindulge in you know what. It can be dangerous. Very dangerous. It'll end up killing you if you're not careful. That would be most unfortunate, sir.
Okay. This is the last one until I get the trophy, I think.
Ari was in record mode when I was fighting with the killer. Perhaps there's something on it.
His watch. His watch off. His watch. Off his watch! His watch! Sorry, off.
Gold watch. I'm sure I've seen this before somewhere.
Right, Cammy? There's loads. It's interesting seeing all the different endings. Yeah, there are many.
The watch they give for promotions to lieutenant. The killer is a cop. Looks like the killer is a cop. Carter Blake. That would explain the dead-end investigation and his desire to frame Ethan Mars. Two receipts from the same gas station. Might be near the killer's home. Cop. There's only one cop in the
Very close, Mr. Awful.
Gotcha. He owns a warehouse
Just gotta
on the
reach.
docks. If I'm wrong,
Just gotta reach the end, Mr. Awful.
Let me stay with you, Scott. I don't want to go.
Look, it'll only take a couple of days. Long enough to get this resolved.
I can't just wait while you confront my son's killer.
It's the only way, Lauren.
It's not the only way.
Now go stay with your mother for a few days. I'll come and get you when this is all over.
Tell me who the origami killer is. I want to know who killed my son.
Listen, when I'm done, I'll tell you everything I know. I promise.
Oh! Oh, I would call you to move it, please. I'll call you to help save me off.
Mom's work is too far away. I'd never make it in time. Need to get help fast. John's gonna drown. John's gonna drown. Hold on, bro. I'll find someone.
Oh, hold on, bro.
Then we'll come back and save you. Gotta find someone. The water's still rising. John won't be able to hang on for long. This place is completely deserted. There's no one around to help. Dad, I've gotta get... Dad, it's John! He fell into a pond! He's
Get out of here, you little pest! Leave me alone!
Come, Dad! Come on! John's gonna die! John's gonna die!
Well, that'll be one less greedy mouth to feed, won't it? Go away!
Please, Dad! I'm begging you! John's gonna die! John's gonna die, Dad! Please, Dad!
Thank you, Off.
Save John!
Off, what if it jumped at you?
John, I really tried, but he wouldn't come. Please don't die, John. Please.
John. Yeah. Joe. Oh, are you sad? Does that make you cry? I'm nearly done. Nearly. Yeah, sure. Sure it is off. Sure it is. Aww. Okay, off. Off? What if there's another centipede? Oh, what if there's a second centipede? Oh, Anne. Aunt Shapardi. Oh, there might be 2 centipedes. 2. Yeah, Off might have 2 centipedes. Mr. Chosen One, Devin.
Lots you touch, girl.
Off, it's crawling up your leg.
There must be something that'll tell me where Sean Mars is. A cop's uniform. Always trust a cop. That's why children went with him. He was dressed as a cop.
Off, where's Wawa?
Shit, it needs a password. Got it. Max. The name John gave to his paper dogs when he was a child. What the hell is that? An address. It's gotta be where Sean Mars is. Hurry. There's no time to lose.
So you found my little secret?
It's over, Scott. All those children.
Alicia, I was just about to ask when you're coming back. I was just thinking you've not come back. How are you? Have you eaten dinner yet? Hello, Privyet.
There might still be time to save him.
Let him go.
Do what your father couldn't do.
Alina, Alicia, Privyet. Yeah. Oh, what did you eat for dinner? Oh my god, please feel better and rest well and drink loads of fluids. And please quickly feel better. I'm good myself, thank you for asking. Ready for my dinner soon. And then after my dinner I'll work more on my schooling. Weetabix. Purple Joker, what's your favourite cereal? Wheat-Bix. Wheat-Bix. Oh my god, is it Weetabix? For real? Exactly. Off. Purple Joker, Weetabix eater. Off. Is this Julia? After you kidnap Julia? Well, after my stream, Alicia, Alina, I will finish my stream, cook dinner, watch an episode of my show. Then I'm going to do some work on my assessment. Fried basil? Is that all? Just fried herbs? Marguerite Baker would love you. What I'm gonna have for dinner? I think pasta bolognese. Off! Let Julia go! Let her go!
I know where Sean is. I've got to tell Ethan.
Dawn! Hi, Dawn! Don Corial. Love you more. Thanks for resubscribing.
I know where Sean is.
Happy 10 months, Dawn.
52 Theodore Roosevelt Road.
Miss you, Dawn. How are you? I'm at university studying nursing.
I'm on my way.
Be careful, Ethan. The killer's still out there.
No one's gonna stop me from saving my son.
Oh, can I come in your van then as well, off? I want some candy. Thank you, Don. Is everything going well at work? I hope you're not overworking yourself. Don't get burnt out. Kami setta, mamamzita. Will you share the candy with me, Julia? Thank you, Don, you charmer. Don, I'm still waiting for you to come back to Shiny Diamond. I'm just a rook boy. 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 I'm just a rook boy.
I've been looking for a long,
Okay, Julie, that's a deal. Don't tell anyone.
looking for a father that would be able to do what mine could not do. Sacrifice himself in order to save his son. Oh, I searched, searched, searched. And then I remembered you.
It's on Thursday, Dom. We're going to watch 28 Years Later together on Thursday.
All those murders, just to find a father capable of saving his son.
Just to find a father? Do you have any idea how it feels to be a worthless nothing in your father's eyes? Believe me, I've suffered just as much as my victims.
I finished your damn trials. Now give me back my son.
He's there. All you have to do is open that grate.
Hi, Chloe. We're just about to get the platinum trophy. Finally. We're at like 10 minutes of probably. How was your day? Thanks for subscribing. Thank you for subscribing at 55 months. Wow. Happy 55 months. And tier 2. Thank you. So that's 4.5 years. So the next one will be at 5 years, won't it? 12, 24, 36, 48, 60. So 5 months. 5 months till the next badge. Yeah. How was your day, hotel business lady? Quite old, Don, like 2013, I think. Got water up his nose. Alicia, Alina. Alina, why is your username Alicia if your name is Alina? It's quite naughty. But you are naughty. Ooh, had an introduction. How did it go? The introduction to manage luxury hotels. You're a luxury hotel worker. That's so cool. I'm very glad you're enjoying yourself. Alicia.
Take your positions. The suspect is likely to be armed and dangerous. All personnel are ordered to shoot to kill. I repeat, shoot to kill. Ash, are the snipers in position?
Yes, Lieutenant. They're ready on your command.
Perfect. He won't get away this time. We'll gun him down as soon as he shows his face. Hey! You there! What are you doing?
Lieutenant, my name is Madison Page. I'm a journalist. I have proof that Ethan Mars is innocent. He's not the origami killer.
What is a journalist doing here? I thought I told everybody to keep their mouths shut. Now get her out of here. I don't want her getting in the way.
Okay, Lieutenant. All right, come on.
You're about to make a terrible mistake, Lieutenant. Ethan Mars is innocent. I can prove it.
That's what's in your hotel and how you can grow your brand. So it's useful information. They're trying to encourage you all to run your own luxury hotels. Raise some competitors. Oof, that should do it. You used to do rescue breaths first if he's around.
Don't leave me.
Yeah. I imagine it's much harder work, but more rewarding as well. I should teach Majesty CPR because he gave up very quickly and wasn't doing it very well. He's lucky his son came back. Jokinat, hi! Ciao, hi Jokinat. It's been a while, how are you? It's good to see you as well. It's been a long time, are you okay? So, have you met any celebrities yet, Chloe?
I thought you were gone.
Dad, I knew you'd come and save me.
I'm nearly done, then it's time for a little bit of dip before dinner and work on my assessment.
Sean, listen. You are the best thing that ever happened to me in my life. I want you to know that whatever happens, I love you more than anything in the world. I'm not dead. I took the poison an hour ago, and I'm not dead.
Yeah? Was it just a casual day, not really too surreal? I bet he's like, what are you talking about? You took the poison. Poison.
Ash, get her out of my face.
Mars didn't do it, for Christ's sakes. He's innocent.
Hey, what are you doing?
Yeah. Get on the bicycle. Motorcycle, sorry. Now she's doing tricks around them all. Donuts around them all. Look at her go. Look at her doing all these donuts.
What do we do? Attention all personnel, hold your fire.
going on?
The cops. They're out here. They have the building surrounded. They'll shoot you if you go outside.
I'll go out alone. I'll talk to them. I'll explain.
You'll be dead before you can open your mouth. Look, we'll all go out together. With our hands in the air, and they can't possibly shoot us. I have the evidence that proves your innocence.
Oh, come on then.
I'm sorry I didn't trust you. I was only thinking about Sean, and I thought...
What was that like, Chloe? Was it a good meeting? Was he down to earth? Cammy, I'm gonna try and stream on Friday. Depends. I'm gonna try and stream on Friday, Cammy said that. Hiya. 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 Yes, please, Cammy. Because you've got plenty of time off, haven't you?
Save me. Please, save me.
Save me. Please save me. No. Noah! Oh! Well, Chloe, you obviously made a good impression, haven't you? Wow. You obviously made a good impression. What are you doing for the next 2 days, Cammy? I'll be in university Wednesday and Thursday. Anyhow. Ooh. Oof. Oh my god, what are you doing at university, Jokinut? What exams do you have? Have fun, Cammy, tata. Mama musita. Mama musita. Johnny. Johnny. Oh, you would have done that, wouldn't you? Oh, nice. What are your favorite strokes? Alicia, please feel better, okay? Sleep well, and I'll see you on Friday, I hope. On Friday. But you sleep well and feel better for Friday, okay? Get some good rest and feel better. I should get the trophy now.
The successful resolution of this case was made possible only by the bravery of Ethan Mars, who the police believed at one point to be the killer. It is no doubt due to his great courage and tenacity that he succeeded in foiling the plans of the Origami Killer. The police commissioner presented him with an official apology today. Our main headline today, it is reported that
Backstroke. I don't like backstroke because I'm worried in case I'm going to hit the end or hit someone in my way.
Shelby, 48, is a former police lieutenant who claimed to be a private eye hired by the families of the killer's victims. Shelby was killed during a massive police operation, but further details have not yet been released to the public.
Not to the public. I think this should get me the trophy now.
Let's just say a friend of a friend let me jump in line. If we like it, it's ours.
Hey, Dad! I think I found my room!
Well,
she's alive!
It's perfect, Ethan.
Ugh.
We'll be able to forget what happened. We'll
What?
lead a normal life. One day it'll all just
Well, that's not...
a bad dream. We've earned the right to be happy now.
How's that gonna work? That can't be work. That can't work. What? I don't know how that's gonna work. So I've just got an email. My class on Thursday morning is 9 until 11. And then I've got a class 11 until 1. So the class 11... So I've got 1 until 9 till 11. 9 till 11. And then 11 until... whatever. So basically... 2 classes back to back. Well, the one in the morning at 9, they've said that they have to cancel it and do it online via Teams. But then after that's ended, I don't have time to go to the university for my next class, so I'm gonna have to go. I have to go there. I'm gonna have to do it from my phone then and just say that I can't do it from my computer because I've got to be at university. I've got a class straight after and I haven't got time to travel if I stay home. And that's quite annoying. I could take my iPad, yes. But surely I don't need to... I should surely do it. Yeah, I don't have to be on a computer, do I? I just have to find somewhere to sit. Yeah, probably do so, Cammy. Cammy, can we sit there? No worries. I'll do that. Yes, take my iPad and do it in the library. And then I can go to the next lesson straight after that. Yes. That is what I'm going to do. Thank you, guys.
You killed my son, Scott. Were you thinking about that when you held me in your arms? I don't know why you did all this.
Off, who are you? Who are you, Off?
Nothing can justify it anyway. I feel nothing but contempt for you. Nothing.
Has it, Armor? Armor, this is nearly done and we're going to play. I'm waiting to get this last trophy and then we're going to play. This should be it now. If it's not, I'm going to play anyway, but this should be it. Off the nice guy. Lol. I'm excited to see what it is, Armor.
I want to see them again.
Right, I need to go for a pee whilst this credit scenes roll. Hopefully I don't miss the trophy.
Stay back! Don't come near me, or I'll shoot! Fucking asshole.
Hello. Did the trophy come yet? Yes, no, no. Okay, I'm hoping it'll come at the end of the credits then. I'm hoping. I'm gonna go downstairs and see if I've got any snacks. I don't think I do, but I'm quite hungry. How you doing? It's chocolate. Nope. Nope. What? Now we just wait for this to finish. Because unfortunately I can't skip it. Very well off. But that was the end, darn it. Come on. Waffle, 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 muffle. Kartoffel. Hi, Faye. I'm good, thank you very much. How are you? I hope you're having a good week so far. Oh, I'm very glad to hear that. I'm glad that you're good. I'm back playing some Dead by Daylight. This is hopefully the last ending I need to see for the Platinum Trophy. Oh, happy birthday! Happy birthday to you. Have you eaten much cake? Gotten many gifts? Happy birthday. Hi David, how are you? I didn't get the trophy. I'm missing something. How many endings are there? We'll do Dead by Daylight then, we'll figure it out next time I stream. But for now, Dead by Daylight. No cake! Oh, treat yourself to some cake. Where on earth is the trophy? Chloe, can you change the game and the title, please? We do some Dead by Daylight now to finish, and then I will check next time. Thank you, Val. I'll check next time what I'm missing. Whoa. I'm on the 2 versus 8 again with more killers. I'm glad, David. I'm good too, thank you. Halloween event! Nice. I'm good too. I'm gonna finish the stream. We're gonna play some games of this and finish streaming, and then make some dinner, and then work on my assessment for university. So it took a while to come out. Oh, Alma's in a match! I bet she's in a killer match. Faye, thanks for subscribing! Thank you very much. I'm very grateful. Where's all my perks? Why have I only got Lucky Break? What? What's happened to all my perks? What's happened? Oh. I thought they were all... Okay, Saboteur, Breakout, Empathy. Saboteur. Thank you, Faye. What are you doing for your birthday? Maybe you're doing something fun. That's what I wore to university yesterday. Oh my god, you're working? That really sucks. You shouldn't be made to work on your birthday. Mas mahal kita, mahal din kita, sana all. That's horrible, you have to work for your birthday. Really nice, thank you, Chloe. I'm really enjoying student life. It's taken a lot of my time, obviously. Like tonight, I'm going to work more on my assessment, which I seem to be doing every single night, but I'm enjoying it and the classes are interesting. Yesterday, we learnt about sickle cell disease, which was very interesting. Sickle cell. I'm enjoying it a lot. I just miss all my free time, you know, to be able to go anywhere I want to at any time, stream anytime.
Memory 6079. The sound of Archie's hands pounding against the door feels 100 miles away.
Pom rakot makmaka. Any codes for the game? Exactly. Everything happens for a reason. Everything happens for a reason. That was what, sorry? It's just me. Crew, what are you having for dinner? Aww. Thank you, Faye. Well, I'm glad you came to say hi, especially on your birthday. On a special day like today for your birthday. Where are you from, may I ask? Oh, that sounds good. Dawson, play with me! Where have you been? Play with me! What was that? I'll look, Dawson, sure. I'll look. How do I get out of here? I want to be out of here! Oh my god, which state are you in the USA? I'm in England. Darn it. How do I get out? Up here. There we go. Finally. Indiana. What's that like? I'm in England. Maybe you can tell by my accent. Well, Cammy, I love you. I'm winning, Dad. Indianapolis and Lafayette. Yeah? Indiana. Do you do good potatoes there? What song off? What song naughty awful? Corn. Do you have loads of cornfields then? Ah. Kick some pummins. Keller's coming back. You can't help me, Faye. Faye, do you like this game? And what do you do for work, may I ask? Got me. Oh, nice. Why does it make you sad though, may I ask, Dead by Daylight? You think it's really like toxic now these days? So many pummins. I used to play it like all the time with my siblings, and then I had like a phase where I was like, oh, this is really, really, really annoying me and not fun. And then I stopped for a long time. What are you? Exactly, Davidaru. Farming Simulator 2025. Good luck to me, I'm gonna need this. I'm gonna need good luck. Please help me. No, please. Help me. I think I'm gonna pass on here. No. David, where do you work? That's sad. That's sad. Rest in diamonds. Rest in peaches. That's really sad. Or Harbour Hotel. Or at a harbour. Armor! Hi, Armor. that's cool. Oh, that's cool. That's cute, that is. What? Oh my god, wait, why have I just... My link tree. Let me see. Let me have a little look. Let me diagnose the issue. True. I think I changed my link tree, that's why. That's it. Yup. Yes, please, Julia. So many links everywhere. Okay, I'm logged in. Let me share this link then. And there. Okay. Nightbot. Linktree. There we go. That should work now. Thank you. That's Linktree. Duh. Oh, thank you, babe. Thank you. Why does nobody want to do this generator with me? Thank you. Oh. Ah. Yes, please. We need the chairs. Emma's coming for me. Thank you. Yeah, sorry. Thank you for trying, but yeah, cheers are for cheering, like, bit saw. Birthday gal or guy. Birthday. Birthdayer. Gary to wolf me? I'm coming. Oh my god, that was hilarious. And then literally, just a few days later, that was banned. That feature was banned. So funny. Off. No! Oh my run! Oh shoot, oh shoot, oh shoot. Oh, thank you. Thank you, Arma. My god, where are pallets? Marky, how was your dinner? Was it delicious? Welcome back, mister. I missed you. Not great. Chicken beast, Philip. Very nice. Mr. Marquetta. Did you take a photo of it? Breast. I was like, chicken beast? How big is a chicken? You're funny. Oh no. I'm so sorry. Ooh, you adventurous chef, Marquetta. You love chicken, don't you? You sure love chicken. I won't tell you what my main protein source is. So you think it's naughty. I love peaches. Maybe. Moi boy. No! Go, go, go! Why? Why wasn't it letting me in? Why was it so slow? Oh, dear me. Darn it. Armor, get out. Escape for me. Oh, that's a shame. Faye, I get it now. Dirty. Oh, you're naughty. Armor, you got out. You got out. So that's for it. I'll do one more arm and then I'm gonna go get some dinner because I gotta do some work. What kind of work should I do today? Yeah, that one. Gosh. I've really got to make sure all of this doesn't... all of it fits in 25 minutes. Oh my god, Cami, what pizza? Enjoy. Enjoy your pizza. Enjoy your pizza, Cami. I'll see you on Friday, mister. I'm going to do pasta off. Pasta. PlayStation player. Bolognese off. Off, you've got pasta in your hair. See you, enjoy the rest of your birthday, enjoy your shower. What the hell's these? What are they? Armor, what are they? What killer is it? Ah. Oh, if you're naughty. Don't be so naughty. Don't be a bad influence, Marketa. Aww. Yeah, and Marketa, you have rice in your hair. Probably Marky, I probably do. Hey, what are you insinuating? I love custard. I don't know what just happened there. Same here, Off. I think it sounds good. What are you doing? What is it you're doing, Mr. Markey? Armor! No! Save yourself! What game is this, Marky? Has he passed a virus onto your game? Hacker got hacked. Marky, you're a demon rush. Aww. I don't know, because you're only playing for the Demon Rush, so you are a Demon Rusher. Yeah, the killer's really tough to play with, play against, actually. Really hard to play against this Akilab. Wawa, sawadika! Kokomamaka for resubscribing. Happy 53 months, Wawa. I'm gonna cook dinner now, Wawa. It's dinner time. Dinner time, Wawa. Bye. Oh, Armor. We could have had a chance if she didn't keep going after me and the other person. Oh well. Wawa, do you miss me? Wow, do you miss me? I miss you too. Right, guys, I'm gonna go for dinner now though, because I am very hungry. So I'm going to go make some dinner, and then I'm going to do some work on my assessment for university. Thank you, Jill. You too. Have a great rest of your day. Enjoy your lunch and dinner if you haven't already eaten lunch. Guys, I'll do my best to stream on Friday. I can't guarantee I'll be able to, but I'll do my best. So if I can't see you on Friday, I'll see you guys on Tuesday. Tuesday is my next day off next week. See you guys. Take care and I'll see you around on Discord. And Shiny Diamonds, don't forget, movie night on Thursday. Bye. Well, I was going to Vietnam. Take me with you. I want to come. I want to go.